The Speaker at prayer.
Almighty God, by whom alone kings reign and princes decree justice, and from whom alone cometh all counsel, wisdom, and understanding, we, thine unworthy servants, here gathered together in thy name, do most humbly beseech thee to send down thy heavenly wisdom from above, to direct and guide us in all our consultations, and grant that we, having thy fair always before our eyes, and laying aside all private interests, prejudices, and partial affections, the result of all our counsel may be to the glory of thy blessed name, the maintenance of true religion and justice, the safety, honor, and happiness of the Queen, the public weal, peace, and tranquility of the island, and the uniting and knitting together of the hearts of all persons and estates within the same, in true Christian love and charity, one towards another, through Jesus Christ our Lord. Amen.
Call of the roll.
Mrs. Holness, Mr. Bartlett, Mr. Holness, Dr. Clark, Dr. Chang, Mr. Montague, Mr. Shaw, Mr. Samuda, Mr. McKenzie, Ms. Grange, Mrs. Williams, Mrs. Malahou-Fort, Mr. Charles, Dr. Tufton, Mr. Green, Mr. Chuck, Mr. Vaz, Mr. Warmington, Mr. Hutchinson, Mr. Terry Long, Mr. Main, Mrs. Cuthbert Flynn, Dr. Dunn, Mr. Morgan, Mr. Davis, Ms. Smith, Mr. Brown, Dr. Brown-Burke, Dr. Charles, Mr. Chin, Mr. Clark, Mr. Heroy Clark, Mr. Cousins, Mr. Crawford, Miss Crawford, sorry, Miss Daly, Miss Davis, Mr. Golding, Mr. Graham, Dr. Guy, Miss Hamilton, Miss Hannah, Mr. Henry Kitts, Mr. Henry, Mr. Hilton, Mr. Jackson, Mr. Lawrence, Miss Lee, Mr. Miller, Miss Morrison, Miss Nita, Mr. Paulwell, Mr. Phillips, Dr. Phillips, Mr. Robertson, Mr. Robinson, Mr. Siblings, Mr. Slowly, Mrs. Vaz, Dr. Wheatley, Mr. Williams, Mr. Wilson, Mr. Witter, Mr. Wright, Mr. Heroy Clark, Mrs. Malahou-Fort,
Statements by ministers.
Madam Speaker, there are 3 statements to be made by the respective ministers of Education, Information and Youth, Health and Wellness, and Culture, Entertainment and Gender Affairs. It is also expected, Madam Speaker, at a later stage for the Most Honorable Prime Minister to make a statement.
Before forward, House Leader, I trust that all the copies of all the statements are here for.
Madam Speaker, I know the Minister of Health
Yes.
has distributed his, and I know
Right, I
the
know
Minister
that.
of Education has also
Right.
distributed hers. And I'm sure that the Honorable Deputy House Leader will distribute hers in due course. So may it
Is
please
there
you.
a copy for us up here? Copy for the Speaker? Where is it? Have they been distributed?
So, Madam Speaker, if you are comfortable with the situation, may I invite the Minister of Education, Youth and Information to make her statement?
Right, and I'll just inform, as the ministers start, we will distribute the statements.
Thank you, Madam Speaker. I take this opportunity to update the House on 2 subject areas. The first relates to the first week of the pilot face-to-face in-school teaching project, and the second is the registration for the e-vouchers under the Own Your Own Device initiative. Starting with the evaluation of the pilot of face-to-face classes in school, Madam Speaker, during the 2 weeks that the pilot will be in action, the process is being monitored. The goal of the monitoring and evaluation process is to determine whether the education system can safely return to physical, face-to-face instruction, fully, partially, or none at all during this COVID-19 pandemic. It is critical that the best practices, challenges, and lessons learned across the schools are identified and shared. To achieve this, Madam Speaker, the following objectives have been guiding the pilot monitoring and evaluation activities. 1, to determine the extent to which school leaders manage the processes required for safely operating the physical environment during the COVID-19 pandemic. 2, to identify the factors that promote COVID-19 safe school operations. And 3, to identify the challenges that prohibit schools from operating in a COVID-19 safe environment. So the purpose of the report this afternoon, we would have completed 1 week or 4 days and would have gotten an interim report. So the monitoring report provides feedback as to whether the initiative is on track to success and highlights the particular areas of weaknesses for immediate intervention to prevent failure of the initiative. Independent data collectors went out to the schools to observe the activities and to provide data and information on the 6 criteria, which are the school's management of entry to the compound, the management of the protocols in the classroom, management of students' movements during class time, school management of break and lunch sessions, school's management of medical emergencies, and school management of movement and interaction in clubs and other extracurricular activities. Madam Speaker, officers from the Ministry of Education, Youth and Information also visited the schools to conduct observation of the activities taking place and to provide guidance where necessary. The data collectors and observers who have visited the schools have since provided preliminary feedback from their observations. The schools are operating a rotation modality, and those students who were not at school were engaged online. The high schools opted to have their grade 11 return to the face-to-face setting, while the primary level has students across the grades. Attendance at the high schools during the first week was approximately 52% of the grade 11 cohort, while attendance was low at the primary schools. One such primary school that has a student population of 128 was reported to have 8 students last Thursday and 28 on Wednesday. Attendance may have been affected by the rain, as it rained throughout the day. Additionally, over the period, 1,115 students were noted to be in attendance, with 52% of that number representing boys and 48% representing girls. I believe that this was a one-day tally of students. Madam Speaker, here is a synopsis of particular aspects under observations. As it relates to the school's management of entry to compound, the overall management of the entry process was deemed to have been satisfactorily managed by the schools in keeping with protocols for preventing transmission of COVID-19. The entry points were reported as adequately staffed and efficiently operated. Students were observed in queues that were adequately spaced at the entry point and wearing their masks to cover both nose and mouth. In those schools with low turnout, there was no need for queuing up, as the few students who turned up came in at different times. In one school, screening activities were moved onto the compound because of the rain. However, it was done in a sheltered, open location before students were permitted to move into the classroom. It is noted as a matter of concern in 2 schools that the infrared thermometer was being pointed towards the forehead of children. Other schools were observed to have efficient use of the thermometer. The time elapsed between arrival and entry was commended in 14 of the schools by the observers who shared their satisfaction in this regards. This means students were screened and admitted within 2 minutes of arrival at the entry point. Parents were not observed accessing the compound, even though it was noted as being allowed only on a need-to basis. Temperatures were recorded accordingly for the records. With regards to mask wearing, 5 of 14 schools had students turning up without masks. An appropriate response was given as students were issued masks, and screening and entry process was subsequently observed. But I want to ask parents to come on board with us and ensure that the students leave home with a mask. Some students wore a combination of mask and face shields. Teachers also wore masks and face shields. Only one of the schools reported a conflict arising at the point of entry. The observer shared that this was effectively and politely managed by the principal. Overall, the management of entry to the compound proceeded efficiently. In terms of management of the protocols in the classroom, the overall management in the classroom space was found to be satisfactorily done by the observers in the schools they visited. Students sat approximately 3 to 6 feet apart and facing one general direction in most cases. The administrators of the schools added print-rich signs to the school's plans to remind students to wear masks, sanitize, and wash hands regularly. Teachers posted updated class rule charts in their classes that highlighted updated rules that were in adherence to the COVID-19 prevention protocols. Similarly, mask wearing, and social distancing were observed in classes monitored for over 20 minutes periods in 13 schools. Teachers were also observed wearing their masks within 6 feet of the student. Students were observed wearing their masks to cover both nose and mouth, except for one high school in which students in a class were observed pulling their masks below their noses. Transition from class to class and subject to subject were managed efficiently by teachers. With regards to wash stations and sanitation facilities, The observers reported that wash stations are visible and sanitizers are mounted at strategic locations in all schools, including on walls, at the entrance of or in classrooms. In some schools, wall sanitizers are in each classroom. Wash stations are also strategically placed, and some are at the rear or side of the buildings. Hand washing stations are also erected on corridors. However, it was observed that one school needed to have hand sanitizer closer to the classrooms. Signs of social distancing images as well as reminders to wear a mask are strategically placed. There are clear markers along corridors, upstairs and downstairs, indicating where students should stand in relation to each other. In terms of management of students' movement during class time, the overall management of students' movements during class time was found to be satisfactory to the observers. Students were observed forming queues and monitored for 5-minute mass breaks on 1-hour intervals and at designated spots in most schools. This was done on schedule of every hour for each class group. Sanitization was done upon entry and re-entry in the classroom spaces, and more specifically on return trips from the restroom. In terms of school management of breaks and lunch sessions, the school's management of breaks, including mask breaks and lunch sessions, were rated as being satisfactory in most schools. The methods used varied from staggered break and lunch sessions at the concessionaire shop or canteen to students being served in their classroom space. In one case, the school had to implement a contingency plan to the original plan due to the inclement weather, where students were served in their classroom space. The management of this was also commended by the observers. Transition from break and lunch to class was also rated as satisfactory. At one high school, all students remained in their homeroom for the day. Therefore, transition to another class or lab was not observed. However, their transition to their break or lunch period was satisfactory. Students exited class in an orderly manner while others remained. It was reported that at dismissal, some parents were outside the school premises awaiting their children. In terms of school management of isolation room and medical emergencies, Madam Speaker, in this area, the overall management of medical emergencies was rated less than satisfactory by a large number of observers. Clear outline of protocols was noticed in 7 schools, but 6 schools had no documented protocols outlined for dealing with medical emergencies, while at one school, the protocols outlined to staff was observed by data collectors were less than satisfactory. In giving the principals of the school an update of this report on Monday morning, we clearly brought this to the attention of the principals. Clearly, the ministry has some work to do in ensuring all our principals and teachers and support staff have it perfectly understood as to the protocols for dealing with emergencies at a school, medical emergencies. The observers noted that isolation rooms to manage suspected COVID-19 related emergencies are suitably placed for ease of entry and convenience. However, no management protocols were outlined for the isolation room in 6 schools, and observers in 1 school highlighted that the protocols outlined in that particular school was dissatisfying. The ministry has already taken steps to engage the Ministry of Health and Wellness on this score. Medical emergencies that were reported are as follows. At one school, 2 students were admitted to the isolation room after displaying symptoms of runny nose, and a boy was admitted due to diarrhea. His parents were alerted. For us to move forward with confidence, we must have our parents on board. Parents have a responsibility to not send students to school if they're having symptoms of runny nose, cough, fever, etc. Parents, we really need you to be vigilant. If students get to school in that condition, of course, our schools have to be ready to deal with these. This, Madam Speaker, was the weakest of the many variables that were observed, yet it is the most important, and so the ministry has to impress on principals the importance of this particular protocol. We have to impress on parents and guardians as well their responsibility in this process if we are to have confidence in the continued phased reopening of schools. With regards to school management of movement and interaction in clubs and other extracurricular activities, this was generally not observed, as the schools in general did not have it. There was one school, though, where some extracurricular activities were happening, and they were not doing it in a satisfactory way. Madam Speaker, in general, the comments are favorable. There are areas to be addressed, however, and the ministry's teams are working with the schools. It is expected, Madam Speaker, that a more comprehensive update will be provided after November 20th, which is the end of the pilot. In terms of the way forward, Madam Speaker, we met with the e-COVID task force yesterday. That is the ministry's e-COVID task force, to update them on the results so far of the pilot and to solicit recommendations or feedback from them regarding the way forward. They mentioned that we should add to our list of variables that are observed, that of the transportation that the students would take to get to and from school. So we will see how best we can include that in our observation in this coming week, in this week. So, Madam Speaker, we continue to seek the support of all stakeholders as we seek the best solutions in our children's interests to continue to return to school in the face-to-face in-classroom sessions. I turn now to the second topic, which is the Own Your Own Device. I just want to update the House on where we are with the plans for the use of e-vouchers for the Own Your Own Device program. As I indicated last week, each member of Parliament will receive 250 numbered application forms in sequence. The packages are here today for distribution. Application forms should only be distributed to needy parents of students who are not on path. All areas of the forms must be completed. Forms must not be copied or reprinted. If that is done, it will be rejected. The information on the application form must be uploaded on the oyod.educate.gov.jm website before December 4, 2020 for verification. The website will go live this afternoon, and persons can also input their information there. Application forms where upload is not possible can be returned to the ministry, and the upload will be done there. These can be addressed to Own Your Own Device Program, 2-4 National Heroes Circle, Building 1, Kingston 4. Each form will be processed electronically for verification and allocation of points. Therefore, all forms must be updated to the website. So the forms are being distributed on the outside, so please ensure that you get your forms before you leave, members. Thank you very much, Madam Speaker.
Thank you very much, Madam Speaker. Let me thank the Minister for the presentation. There are a couple of questions I'd like to ask. But before that, Minister, I wanted to make a suggestion just in terms of the various factors that you are monitoring. It would be good to have some kind of matrix that allows us to see each factor that is being monitored, what is considered satisfactory in terms of what you are expecting, and also for us to have a better understanding as to what percentage of the schools would have met these criteria, and a little bit more specifics about some of the work being done to bring them up to par. So that's, I just wanted to mention that. In terms of what is in the report itself, there was mention about the low attendance from some schools, and I know that in one or two cases the point was made that the low attendance might have been due to rains that fell on the days of observation. I was not certain if the entire process of observation took place only in the rainy period. So, and I'm not sure also, for those that were not affected by rain, what were the contributing factors in those cases as well. I noted in terms of the report that the data collectors went out and they checked for those things that they could observe and so on. The one that I did not see, and everything tells us during this time that the mental wellness of our teachers and our students are important. And I didn't see anything in the report to speak to that. And I wondered whether or not that aspect was also taken into consideration. The other point that would have been missing also from the report, and I note that there was a consultation with the principals, but feedback from principals in terms of how the program is going, not just simply a checklist of the factors, would also be important, I believe, for us to understand the situation. As it relates to the second point that was covered, which is around the own your own device, I am pleased to come today and actually see in front of me an envelope that I suspect would include the forms. And I wanted to make that clear that if it is, that these are the forms that we are receiving it today. And I say it, Minister, because from as early as this morning, individuals have been bombarding certainly my office and the schools about this particular program. In fact, I think it was unfortunate that many of the schools where parents turned up asking whether it was the principals or the guidance counselors about the program for which they have such an interest, there was no information available. I believe it is important, since the site is going to go live later today. The last time that you spoke, the date was mentioned and no time was given. And therefore, it is understandable that on the opening of the business day, individuals were looking forward to it going live. And we also have to be careful as we do it to keep the trust going. And therefore, it is important to just ahead of time to say it is today, but it is later today, or in Parliament you'll get more information, just so that individuals don't think it's a hoax of some kind, because we know that the trust level is pretty low and we want to keep our parents with us. Minister, I still remain concerned of the students that are left behind, and the fact that, and I know that this is the first stage and we are looking at those on-path, non-path in specific grades, but I still remain concerned about the students in those grades in between and what's happening to them now. And I believe that as we update the Parliament and the nation about what's happening to these specific projects, we also need to ensure that we are updating Parliament and the public on what's happening to educating all of our children. Thank you.
Thank you, Member, for those comments. With regards to the issue of the matrix of factors and the percentage of schools who have met these criteria, those points are well taken, and when I report the next time, we'll try to get the data in a more compact form. You are correct in terms of the low attendance. That caught my attention as well in some schools, and it is something that we really need to drill down into as to why. And the mental wellness, of schools. But that's an important point. And in terms of feedback from the principals, I know yesterday morning when my team met with the principals, they would have gotten quite a bit of feedback from the principals, and we'll collate that for the next time that we speak. Moving on to the Own Your Own Device, yes, I did indicate that the website would be available today. Unfortunately, there were some glitches, but my understanding, you pulled it up? It will be ready before the end of the day. Actually, if you go there now, you will see the landing page, and it will tell you the time that it is going live. So again, technology is great, but sometimes it fails you just at the wrong time, and that's what happened today. And I agree with you as well in terms of doing everything we can so that no student is left behind. This is a big task to get devices, whether it's laptop or tablets, into the hands of our students, but that is the vision, that is the goal of this government. That is what we will work to do, and as Minister of Education, Youth and Information, I will not stop, I will not relent until all of our students have a device, have a laptop or a tablet in their hands. We're mindful as well that that is only one of the factors. The connectivity is the other factor, and I know Minister Vaz is running as fast as Usain Bolt to try to get connectivity to the far corners of Jamaica. The government has an ambitious program to have a uniform broadband network infrastructure available across Jamaica. I know that takes some planning. It takes a bit to get that in, but in the interim, while we're doing that planning, schools are being outfitted with satellite connectivity for internet. Already, there are about 35 schools that did not have internet connectivity last month that have it today, and we're moving on to ensure that at our schools we have internet connectivity. Education is important. Education can move us from having, $5,500 US per capita income. It can move us to $50,000, $60,000 US in per capita income. And so we're mindful of the fact that we ought not to leave any student behind. And so I thank you for your questions and observations.
If with the permission of the speaker, just a follow-up. Minister, I'd also like to, at the end of the project, that's the Own Your Own Device, to ask that a report be submitted that gives us a clear idea as to the distribution of the tablets. I believe that when we're looking at benefits that go out to the entire population, it's important to keep all of us up to date in terms of we know how it's being done in terms of the modalities, that's clear. But at the end of the day, if we have a report that allows us to see how those tablets were distributed based on the process across the island.
So noted.
Madam Speaker, I invite you to allow the member from West Central St. Catherine and Minister of Health and Wellness to make his statement.
Dr. Tufton? Members, can I ask you to lower your voices, please, so that we can hear?
Thank you very much, Madam Speaker, and thanks to my colleagues. Madam Speaker, we're living in a period of transition and transformation in so many ways. this transformation and transition has been brought about by the advent of the COVID-19 pandemic and its concomitant impact on our social lives and indeed on our overall well-being. From the provision of health services, Madam Speaker, to the operations of the economy, we're continuing to feel the effects of what we classify as the new normal that has been brought about by the different infection prevention and control protocols. As a member of this administration, Madam Speaker, I am proud to say that despite all the challenges, there are things that we can do, and our health system continues to rise to the challenges of protecting our population. Our efforts have resulted in many successes, which can be seen in our management and control of the pandemic thus far, and we pay tribute to all of those who have played their part, including the Jamaican people. We are in challenging times, Madam Speaker, but we must also focus on the opportunities that we have to bring about further changes in the healthcare system. We must draw some important lessons as well. One such opportunity, especially for us in health, is that of the reemergence of health and wellness as a national priority. Indeed, Madam Speaker, the Cabinet, in its recent decision relating to the priorities for the medium-term socioeconomic framework, has elevated health and wellness as part of 6 strategic priorities that will be the focus of policy over the medium term. We have an opportunity as well, Madam Speaker, to examine the critical role that non-communicable diseases, commonly known as lifestyle diseases, play in the outcome of persons who become infected with this coronavirus. We now have the data, and we have examined that data. According to a report published by the World Health Organization, Madam Speaker, obesity increases the risk for becoming severely ill from COVID-19. People with diabetes were up to 3 times more likely to have severe symptoms or die from COVID-19. Hypertension, cardiovascular, and diseases increase the odds for severe COVID-19 multiple times, at least twice in some instances, sometimes as much as 3 times. Patients with chronic obstructive pulmonary disease were at increased risk of severe complications or death from COVID-19, and mortality rates from COVID-19 was significantly increased in patients with cancers and was particularly high among those with blood cancers. Additionally, Madam Speaker, smokers were 1.5 times more likely to have severe complications from COVID-19. And the study also found that alcohol impairs the body's ability to fight infections, and therefore, in being infected with COVID-19, if you abuse alcohol, you're likely to be worse off. In my sectoral presentation, Madam Speaker, I had sought to advance the health and wellness agenda of the government and how important this is for the development of a productive economy. Madam Speaker, as outlined in the 10-year strategic plan and the capital expenditure development plan earlier this year, health facilities across the island, the government must ensure and is ensuring that we tackle the rising scourge of NCDs and the associated risks, both from a public health perspective as well as an economic perspective. Integral to this strategic direction is the establishment of a framework anchored in 3 main pillars: prevention, treatment and care, and infrastructure development. Under the prevention component, Madam Speaker, we had launched and supported the Jamaica Moves program, which sought to change the mindset of Jamaicans. I have constantly pointed out in this House and elsewhere that there must be greater emphasis on behavioral modification as a key tool in the fight against NCDs. As such, we must begin to recalibrate our strategies to understand the value of changing hearts and minds and having people focus more on ways of improving their own health. The government is committed to tackling the challenges but we also believe that individuals and communities have an important role to play. Some of our health practices are embedded, Madam Speaker, in our history and certain norms and practices. We recognize, therefore, that our strategies must also respond to these social and historical challenges. It is very important that we try to steer people towards healthier practices, which will also help to reduce the broader social and economic cost of poor health. In this financial year, Madam Speaker, we intend to expand the program of prevention to include a number of critical supportive policies and legislation. These will enable us to strengthen primordial prevention strategies and will include the following. We intend this year, Madam Speaker, before the end of the calendar year, if not certainly before the end of the financial year, to table the tobacco control legislation, which is going to provide significant overhauling of our approach to tobacco consumption. The tabling in Parliament of an alcohol policy. The advancing, this is a green paper now, Madam Speaker, for discussion purposes. We're almost complete. It is to go to Cabinet and then tabled. The advancing of front of package labeling. We believe that consumers must know what is in their food, and front of package labeling is going to be a critical area of advocacy and hopefully policy change over time. The completion of a sodium and sugar study to determine baseline presence of sodium and sugars in our diet, and new policies on the use of sodium and sugar. Establishing the NCD task force to support consultation and collaboration, as well as research and development in the area of NCD prevention. The completion, Madam Speaker, which is now in progress, of a trans fat baseline study to establish empirical evidence to support new policies in relation to fats and the consumption of fats or trans fats in our foods, and greater emphasis on implementation of the breastfeeding policy as a means of preventing childhood obesity and establishing a good nutritional base for children. Madam Speaker, I now turn to an initiative which we launched today as part of this overhauling of our public health approach in keeping with this living with COVID or new norm. Learning to live with COVID, Madam Speaker, has been one of the key themes of our strategy in the public health response to this global pandemic. Madam Speaker, in keeping with that theme and in keeping with the strategic direction of the 10-year plan to strengthen partnerships in health, today we launched the Public-Private Partnership for Non-Communicable Program, or PPP for NCDs. Madam Speaker, this initiative will seek to maintain essential primary care services for non-COVID-19 clients with diabetes and hypertension, enabling them to access routine care through private physicians and to free up the resources of the health centers to focus on critical cases and the pandemic response. In other words, Madam Speaker, this is a pilot project that will see public patients in the category of hypertension and diabetes, or selected patients in that category, now having access to a private physician as part of their routine care to reduce the burden on our public health system and ensure we focus on restoring or responding to COVID. The significant demand, Madam Speaker, that the pandemic response has placed on the resources of our health facilities has meant that other types of diseases, and particularly non-communicable diseases, have not received the attention that they require in terms of treatment and care. Madam Speaker, in this pilot phase, some 5,000 patients who are on the register of the health centers will benefit from this partnership. Potentially, Madam Speaker, some 1,000 beneficiaries can be added to the program further as we identify more private providers. The PPP for NCDs program, Madam Speaker, which is aimed at minimizing the exposure of clients with chronic illnesses to COVID-19 at the public health facilities, will initially focus on patients with diabetes and hypertension, as these remain diseases of significant concern in Jamaica. Madam Speaker, let's bear in mind, reminding the Honourable House and the population, that some 70% of deaths in the population are due to an NCD lifestyle disease or a non-communicable disease. Our most recent health and lifestyle survey, Madam Speaker, tells us that 1 in 3 Jamaicans have hypertension, 1 in 8 are diabetic. Madam Speaker, these conditions make persons who may contract COVID-19 more susceptible to poor health outcomes. This is particularly concerning for our senior citizens who are at a higher risk of becoming severely ill from COVID-19. So far, Madam Speaker, our data shows that over 70% of COVID-19 deaths in Jamaica have occurred in persons 60 years and older, while 92% of COVID deaths have occurred in positive patients with 1 or more non-communicable disease, with 61% prevalence, and diabetes was the third, with just over 26% prevalence. Madam Speaker, the public-private partnership for the provision of services to public patients with diabetes and hypertension will start as a pilot within 8 health centers and 4 private practices in Clarendon, St. Ann, and 2 in Kingston and St. Andrew. Patients on the diabetes and hypertension register within these facilities will be selected based on a predefined inclusion criteria and will be referred out for treatment and care to the private doctors. Madam Speaker, the local health center will identify the eligible members of the community, refer them to the private practitioner to continue their care. The health center, of course, will ensure that communication is maintained with the private practitioner and that the necessary protocols are in place for patients to be referred back to the public health system if the need arises. Patients will have no out-of-pocket expenses, Madam Speaker, very importantly. So this is a cost to the government, not to the patient. And Madam Speaker, the patients will still have access to the NHF drug serve, and NHF will engage and manage the relationship with these private practitioners. So they will get to see the private practitioner, no cost to them, that is negotiated by government, and they will be able to go to the drug serve window and continue to get their medication at no cost. Additionally, patients will still be able to access diagnostic or monitoring tests free of cost, and the private practitioner, Madam Speaker, will be able to provide a point-of-care testing for diabetic patients, thereby reducing the need to interface with the public health system. Patients, Madam Speaker, are also allowed 4 routine care visits and 2 ad hoc visits annually. And this, Madam Speaker, is in keeping with the patients that have been selected based on their particular health profile associated with these conditions, and would be adequate, the numbers of visits that they would have to deal with their particular situation. If things changes, then we could elevate or adjust the approach. Madam Speaker, the Ministry of Health and Wellness is pleased to be partnering with the 4 private practitioners who were selected for the pilot. When the expressions of interest for this program was advertised earlier this year, we received some 60 applications for private providers. And of that 60, there were 4 were selected for the pilot. The government of Jamaica is committing, Madam Speaker, some 100 million Jamaican dollars to this pilot. We have taken steps to ensure that patients who will be referred from the public health system to these selected private practitioners will receive the highest level of care. This will be achieved through the issuing of an interim guideline for the clinical management of diabetes and hypertension for public and private practitioners, developed, Madam Speaker, in partnership between the Ministry and the Association of Consultant Physicians of Jamaica. We will also be supporting our private partners, Madam Speaker, through ongoing updates and training to ensure that standards are maintained. This program is also supported by the National Health Fund, an agency of the Ministry of Health and Wellness, which will be facilitating payments to the private practitioners through the NHF swipe card system. Madam Speaker, the launch of this private program, this pilot program, represents a model that the ministry will be expanding on as we continue to navigate the COVID-19 pandemic and restore comprehensive healthcare service delivery within the public system. I wish to thank, in closing, the technical team at the ministry, led by the Permanent Secretary and the Chief Medical Officer, supported by a number of technical personnel within public health, but also in the private space, and to encourage continuation, Madam Speaker, of the partnership that is so necessary in addressing COVID-19, but also in elevating the public health response in this new norm that we have to confront as a people and as a country. Thank you, Madam Speaker.
Thank you very much, Madam Speaker. First of all, Madam Speaker, I'd like to thank the Honourable Minister for the statement outlining one area of our health sector which over the many years has dogged the ability to provide good health care for the nation's people. And that is the whole aspect of NCDs in the population. And increasingly, Madam Speaker, we are seeing that, as the Minister pointed out, that more and more people are suffering, for want of a better word, from diabetes, hypertension, and obesity, which in a significant way seem to be part of the root cause in many of these manifestations of these conditions. The program of Jamaica Moves that the Minister has started, which is a continuation of a program of moving, that has, yes, and the Minister agrees, that has started over many years, is one step in that direction, Minister. And it is in an effort to encourage more Jamaicans to recognize that it's not only diet which is important, but diet and exercise in trying to stave off the onset of these NCDs and to maintain a healthier lifestyle. The fact that COVID has presented another challenge and has given rise to the fact now that those who have these NCDs are more likely when and if they contract COVID to develop serious complications, and the evidence is there to suggest that the vast majority of those who have died from COVID are those who have some sort of comorbid conditions, and the NCDs play a significant role in these comorbid conditions. So the truth is that we as a nation need to wake up even more to understand and appreciate that our health is our own problem. Our individual health, is our own problem. And whichever government decides that they are going to put this program or whatever program in place, I think what needs to get to the individual person out there is that I am responsible for my own health. And part of the challenge we have, Madam Speaker, is that however you put the message out there, whatever message you put out there, sometimes people are resistant to this particular message. But I take some sort of comfort, and I think we all do, in that the more you put that message out there, the more it may reach some of those persons who will not readily take that message. If you look around this room, Madam Speaker, and if you were to introduce a scale in this room, a significant number of our members here would fall outside of the BMI, the body mass index that would be, that would be considered normal. But we are a reflection, Madam Speaker, of what happens out there in the general population, right? And I am sure that there are some members here who are a little dissatisfied that the Minister says one of his things that he's going to be doing with some amount of alacrity is this particular aspect of bringing the legislation regarding alcohol use and alcohol abuse, because they tie in somewhat to, Madam Speaker, to the whole aspect of obesity, hypertension, and a sort of sedentary lifestyle. So, Madam Speaker, this statement today is welcome. It's even more welcome when we consider that we are living in this COVID condition. The arrangements that the ministers announced with the PPP for NCD is also one that is welcome. And why do I say that, Madam Speaker? During the COVID period from March onwards to now, when many of the health facilities, the public health facilities, were not able to see the number of these NCD patients from diabetes, hypertension, whether it is congestion at the health center or a fear of these elderly patients to go to the health center, many of them had their conditions out of control. The hypertension was out of control, the diabetes was out of control. Sometimes you had a situation in the early stages when they went to these public health centers and they, in an effort to ensure that they had medication continuously, they were given a 3-month supply. Within this 3-month period, many abuses were done, Madam Speaker, in terms of how they took their medication and what. And we saw, and many of my colleagues in the private health center saw many patients coming in who were seen at clinic, but who were out of control. And this is not good, because being out of control, it means that you have progressed the disease and the condition even further with its potential complication. So, Minister, this particular program that you have partnered with, that you have launched today, is welcome, and I think it is something that the family practitioners and the private practitioners across this country should warm to and take up this particular offer. I have a particular concern, though, Minister, and even as much as at the same time we are doing the preventative aspect and driving home the point about prevention of these NCDs, we all know that there's a significant number of persons in the country right now as a consequence of diabetes, less so hypertension, have chronic renal disease who require dialysis. Can you indicate to the House if there's any program of enhanced care for persons who need renal dialysis above the numbers of facilities that you have currently, numbers of stations that you have currently in the country, so that whilst at one end you are looking at preventing the NCDs, right now, as we speak here now, there are many out there who can ill afford to do the dialysis in the private sector. And in the public sector, the number of stations are reduced, and they have no resort to getting this very vital and important treatment. So it is something that is or ought to be looked at to Minister, because we recognize that the public advocacy for lifestyle changes will inure to the future generation. But we have people now, and we need to ensure, Madam Speaker, that we care for them as adequately as we ought to do for the future. There's a question I'd like to ask, Minister. You indicated in the program, in your statement here now, and I recall the last time you mentioned about this care for patients in the public sector to do the diagnostic tests, that you indicated that it would only be from the hospital setting. Can you now indicate whether this, because your statement seems a little contradictory in that now you're saying that with this partnership with the private general practitioners or private practitioners, physicians out there now, that yes, the point of care testing will be done, but they will also have access to the diagnostic tests. Can you indicate whether that in this arrangement that you are now having with the 4 on the trial now, as well as those others that you expect to come on, that they will be able to send patients for diagnostic tests under that compassionate care program that you have in place? And finally, Minister, I would encourage, well, not finally, but I would encourage our Madam Speaker, I know that you know I'm winding down. that you will encourage our people to take advantage of this. And the final thing, Madam Speaker, is that in closing, I'd like to congratulate all those and commend all those doctors and nurses and frontline workers out there who have been working to ensure that the health of our country is protected. I don't think my saying it once again is really enough, Madam Speaker, but the more we say it and the more we show appreciation to them for protecting us, I think it will sit well with them. Thank you very much.
Madam Speaker, let me thank the member for his endorsement of the program. I think, being a medical practitioner himself, in seeing the value in the program, it is an overwhelming endorsement. I believe that we are in fact moving in an appropriate direction given the challenges that we face as a people at this particular point in time. So I want to thank him for that, and any additional ideas he may have, I'm more than open to accept and to take on board those ideas so that we can start us balancing that through to addressing the diabetic and the hypertensive. Then you hopefully will address. So it's all connected. Having said that, to those who are actually experiencing renal failure and require attention, the public health system, as you know, offers significant support, but it's never enough. And it's never enough, member, again, as you know, because we have failed to date in our efforts to get behavioral change, which is why I say programs like the Jamaica Moves and others are important for long-term changing in behavior and culture. But we do offer a program to support persons who are not on the public system called the Compassionate Care Program. Many have applied. Members of Parliament have made representation. And we gave some support through that program. Last year, we spent over 150 million Jamaican dollars. In fact, this year, we exhausted the 150 million that was allocated through the NHF. And I've just applied for an additional top-up because of the long list, not just of this particular condition, but several others. The truth is it's not adequate, because if you give someone with renal failure $200,000 or $300,000 at $12,000 to $15,000 per treatment, with an average requirement of 3 treatments per week. Some persons do 2, but it's not the optimum number because of cost. It doesn't take very long before that money is exhausted. So I'm not saying to you that it is a solution. The prevention methods represents the solution, but we do offer some additional care. Beyond that, the management of nephrology, which captures renal issues, is one that we have been looking at, working with the Ministry of Finance to look at a broader public-private partnership going into the future for a more sustainable program. And it has gone as far as PMSEC, and there has been some approval for the program. We will have to determine how COVID and all the other concerns and competing interests have or may have changed that. But what is clear is that the government is thinking about it, has been thinking about it, and has felt that there is a need for a more sustainable approach right through the spectrum from prevention to treatment. And we will say more about that once we can determine a more sort of concrete path. On the second question of diagnostics, the simple answer is yes. For those patients who are on the program, the 5,000, they will have access to all the services that public health offers. So the only difference is that they are going to a private practitioner, who we have negotiated with a predetermined rate, with a certain amount of visits that they are guaranteed, with some additional visits, 6 overall per year. And to the extent that they need diagnostic services, hospitalization, drugs, they are still, for all intents and purposes, a public health patient, just that we have outsourced some of the services. And so the answer is yes to that question. Thank you very much.
Minister, if I could just ask 2 questions of the Minister. Minister, could you indicate This is a pilot program for roughly 5,000 beneficiaries costing $100 million from the National Health Fund. Do you have a sense of the size of the problem in the COVID era of persons who are not able to access their normal care because of the exigencies of COVID and the need to use the public health assets to tackle the pandemic? What is it in terms of the number of persons who would be affected in that way? And what is the duration of the pilot? And if it's successful, what would be the anticipated cost of extending it and broadening it to those other patients that may not have been included in the pilot? Or what is the plan, in other words? It being a pilot, what is the plan going forward if the pilot is a success after the period that you anticipate it to last?
Thank you, Member. I can't give you specific numbers now, but I know that it is a problem. In fact, hospital visits, and I've asked them to tabulate going into the end of the year, hospital visits in particular areas have actually shrunk over the last year because of COVID, because of the restrictions. And we have seen anecdotally, both in the public space and as well as in the private space, where visits to doctors, particularly for senior citizens, and I quoted that in here with the Eldemar Shearer study, who is a geriatric practitioner, has declined significantly because the older population are just scared about going out, or because of the restrictions, they don't go. And that has had many consequences. So it is a problem. I can get some specific numbers because we need it for planning, and I think it's a good question, and I've asked for that. On the issue of duration, it's a function of in the first instance, I'm almost sure it's 6 months, but let me just confirm that. The 100 million for 5,000, you can do a quick calculation. The only variation would be whether persons exercise the right for 4 visits, because they do have the flexibility to take 2 additional visits depending on their condition. So if they exercise the full 6, it makes the modeling a little different from if they did 4. But you can get an idea as to how long it will last. We will, however, since it's a pilot, assess it on a month-by-month basis to determine the success or otherwise of the program, which means talking to the patients, interacting with them, which our health centers will do, our clinics, interacting with the practitioners, monitoring for quality control, because there is a data collection process, determining, how the process is working, how smooth it is working, what's the impact of the program on the health centers or the clinics in terms of reducing the numbers and improving the efficiency of delivery for other patients who have to use those facilities. So at the end of that process, Member, we will determine how successful. If it is successful, then I think we will find a way to put it as a permanent fixture, if not in many areas, at least in some areas, to address the concerns of just a more optimal arrangement. We are committed, though, because we think that private-public partnerships can work if properly thought out. And indeed, healthcare is not just about public health. It's in our context and culture and structure, it really is about how you combine the public and the private to get the best results for the population. And so in principle, if the successes are there, we will commit to advancing the program further.
House Leader. House Leader.
Madam Speaker, the next statement will be from the member for Central St. Catherine and Minister of Gender Affairs, as she will be talking about the gender matter.
Minister Grange.
Thank you, Madam Speaker. Madam Speaker, as Minister with portfolio responsibility for gender affairs, I rise in this honorable House to acknowledge the commemoration of International Men's Day, which is celebrated annually on November 19. And I'll ask Madam Speaker, all the female members of Parliament to applaud our male parliamentarians this afternoon. International Men's Day is celebrated in countries such as Canada, the UK, Singapore, USA, Australia, Haiti, India. As a symbolic show of support, I ask that each member wears his or her white ribbon throughout this week, and those who are not wearing white ribbons, I will ask the orderlies to just come around so you can get pinned with your white ribbon to show love and respect and honor for our men.
Yes. They're here.
This is a time when we pause to recognize and honor the men and boys in our society.
Yes.
We celebrate fatherhood, paternal bonds, and the efforts of male parents towards their family and our society. It is important to recall and recognize the endless efforts, initiatives, and contributions of our Jamaican men and boys. And I'm going to ask the orderly to just hand out those ribbons, please. International Men's Day is a day to focus on men's health, improving gender relations, promoting gender equality, and highlighting positive male role models in the society. Additionally, it provides an opportunity for men and boys to celebrate their achievements and their contribution to community and national development. Let's recall the broad objectives of International Men's Day, which were ratified in 2009. 1, to promote positive male role models, not just movie stars and sports personalities, but the everyday working class men who are living decent, honest lives. 2, to celebrate men's positive contributions to society, to community, to family, to marriage, to childcare, and to the environment. 3, to focus on men's health and well-being, social, emotional support, physical and spiritual. 4, to highlight discrimination against men, because men at times are discriminated against. Discrimination in areas of social services, social attitudes and expectations, and law. 5, to improve gender relations and promote gender equality. And 6, to create a safer, better world where people can live free from harm and to grow to reach their full potential. It has been customary for International Men's Day theme each year to take its cue from one of these 6 pillars which support the observation of the day. And so this year, our local theme is A Man's Health is a Man's Wealth, Men and Healthy Lifestyle Practices During the Pandemic. It is drawn from the pillar which puts focus on men's health and well-being, such as social, emotional support, the physical and the spiritual, and was conceptualized to encourage our men to continue to fight to reduce the spread of COVID-19 and to sensitize our men and boys on ways to improve their mental and physical health. I know that our men ever so often, Madam Speaker, take their physical and mental health for granted due to cultural and social norms that say men must be tough, men don't need counseling, or the favorite, men don't need to go to no doctor, just drink tea. In fact, Madam Speaker, some men are terrified about going to the doctor. And when they feel a little pain, they can hardly bear it. I want to use this opportunity to encourage our men and boys to take their physical and mental health seriously. Your health is your wealth. Do your routine checkups and make healthy lifestyle choices. Madam Speaker, as the Gender Minister, I remain committed to support men and boys in Jamaica and also within the diaspora. The Special Service Unit in the Bureau of Gender Affairs was designed to address issues affecting our men and our boys. Through partnerships, the Bureau of Gender Affairs has hosted workshops, seminars, conferences, and counseling sessions to promote positive images.
Gentlemen, the Minister is paying a tribute to you all. The Minister is on her feet. She's paying a tribute to all the men today.
Madam Speaker, I'm not going to ask you to name anyone, but some still have not heard you. So, Madam Speaker, through partnerships, the Bureau of Gender Affairs has hosted workshops, seminars, conferences, and counseling sessions to promote positive images of men and boys and address different aspects of manhood and fatherhood. These sessions have helped to foster greater parenting skills and provided men with the resources to play a more active role in the lives of their children and, by extension, the family. At the International Men's Day Forum in 2019, Madam Speaker, 2 male initiatives were launched. And I will now provide a brief update on the implementation status of both programs. First, it was the Mentor Me 2020 Male Mentorship Program. And this program was designed to assist boys at the secondary school level to receive support and guidance from positive male mentors to develop self-efficacy life skills and improve the academic performance of interpersonal relationships among the boys, among their peers, among teachers and family members. So, Madam Speaker, we selected as the pilot 2 high schools to participate in the program, the Haile Selassie High School and the St. Andrew Technical High School. From both schools, 15 boys were selected to participate in the first cohort of the program. And today, I am proud to say that we have identified 15 suitable male mentors who will coach and empower the boys in this program. Madam Speaker, I want to use this opportunity to encourage our men to join this initiative and to contact the Bureau of Gender Affairs to become a mentor to some of our boys in the secondary school system. Then we had a second program, which is the Young Fathers Jamaica Initiative. And this program was designed to assist young fathers between the ages of 15 to 19 to improve their parenting roles and responsibilities, develop life skills, and improve the interpersonal relationship between them as young fathers and their immediate family members. Here again, Madam Speaker, I'm proud to report that after several consultation meetings with relevant stakeholders, we were able to identify 20 young fathers to participate in this first phase of the program. As we celebrate International Men's Day 2020, I would like to bring to your attention the activities that will commemorate International Men's Day. One, on Sunday, November 15 past, last Sunday, we had a commemorative church service which was held at the Constant Spring Church of God. And the Honorable Minister of State spoke at that service to launch the activities. And they observed social distance on that occasion. And then on Thursday, which is the actual day that we observe International Men's Day, we will be hosting a forum at the Jamaica Pegasus Hotel from 10 a.m. to 3 p.m. And this forum will include the following activities: presentation of awards to Jamaican fathers, who we refer to as outstanding fathers. And these are men who have shown exemplary work in their role as fathers, mentors, and role models. And this award is usually presented in June to commemorate Father's Day. However, due to the COVID-19 restrictions, the awards were not presented to the fathers at that time. And so we will use this opportunity to make the presentations. The second activity will be what we are referring to as a soft launch of a Male Role Model 2021 calendar. And it's a joint initiative between the Bureau of Gender Affairs and the AIDS Healthcare Foundation. The calendar will present an opportunity to recognize our men from various backgrounds and professions across Jamaica. And the face of each month will be tied to local observance and celebrations. And so men like to do calendars of women. That is the tradition. But on this occasion, we are doing calendars that will promote our men, positive men who do positive things. So, Madam Speaker, in closing, I want to reinforce my commitment to our men and boys and to indicate that the Honorable Minister of State will lead the charge during this celebration to ensure that our reach is far and wide. I encourage all our women to celebrate all our men who are deserving of such recognition. I'd also like to use this opportunity to acknowledge all male groups and networks, and we do have a very wide network of male groups across the island who we work with very closely to ensure that it's not only about taking care of our women, but looking out for the interests of our men and our boys. And so, this afternoon, again, I just want to say Happy International Men's Day, and may our men continue to partner with the women of Jamaica to make this country a great country. Thank you, Madam Speaker.
Madam Speaker, let me, on behalf of this side, thank the government for the acknowledgement of International Men's Day. We often celebrate our women to some extent, sometimes to the exclusion of our men. And to commend the Minister for the initiatives that the government is currently undertaking, particularly around the mentorship program for young men and the program for young fathers. I think we all recognize one of the greatest challenges we face with crime and violence. The young men are both the victims and the perpetrators. And I think to tackle some of the societal challenges we have to actively re-socialize many of our young men. So I think, one, the recognition of men and the positive role models is important, and the programs that are in place to try and get a change in behavior is also important. So we commend those, and we will support those initiatives to build a better society for all of us to live in. Thank you.
Announcements.
Laid on the table of the House today are the following. Report of the Standing Orders Committee of the House of Representatives on the proposed amendment of Standing Order 73D. Report of the Ethics Committee of the House of Representatives on its deliberations on the motions for exemption brought on behalf of
at law, which may from time to time enter into contracts with the government of Jamaica and its affiliated agencies. And whereas the member has disclosed her interest in this firm, be it resolved that this motion be referred to the Ethics Committee of the House of Representatives for consideration and report. Madam Speaker, I have a further motion whereas subsection 1G1 of Section 41 of the Constitution of Jamaica requires a member of this Honorable House of Representatives to vacate his seat if any firm in which he is a partner or any company of which he is a director or manager becomes a party to any contract with the government of Jamaica for or on account of the public service, or if he becomes a partner in a firm or a director or manager of a company which is a party to any such contract. And whereas the Member of Parliament for St. Catherine South Eastern is a director at Armoset Security Services Limited, Ben Mill Transport Limited, and La Sierra Farms, and Company Secretary of Kaelin Distributors Limited, a supplier of cosmetics and pharmaceuticals. And whereas these entities may from time to time enter into contract with the government of Jamaica and its affiliated agencies, and whereas the member has disclosed his interest in these entities, be it resolved that this motion be referred to the Ethics Committee of the House of Representatives for consideration and report. And a third motion, Madam Speaker, may it please you. Whereas subsection 1G1 of Section 41 of the Constitution of Jamaica requires a member of this Honorable House of Representatives to vacate his seat if any firm in which he is a partner or any company of which he is a director or a manager becomes a party to any contract with the government of Jamaica for or on account of the public service, or if he becomes a partner in a firm or a director or a manager of a company which is a party to any such contract. And whereas the Member of Parliament for St. Catherine North Western is a director of Paramount Trading, a distributor of chemical raw materials, main events, entertainment, and event management, digital signage and promotion services, and Examaca International, an entertainment company. And whereas these entities may from time to time enter into contracts with the government of Jamaica and its affiliated agencies, and whereas the member has disclosed his interest in these entities, be it resolved that this motion be referred to the Ethics Committee of the House of Representatives for consideration and report. Madam Speaker, I further beg to give notice that at a later stage today, I will move for the suspension of the standing orders to enable me to take these motions.
Madam Speaker, I beg to give notice that at the next meeting of the House, I will move the following motion. Be it resolved that the report of the Standing Orders Committee of the House of Representatives on the proposed amendment to Standing Order 73D, which was laid on the table of the House on the 17th day of November 2020, be approved. Madam Speaker, I further beg to give notice that at a later stage today, I will move for the suspension of the standing orders to enable me to take this motion. Additionally, Madam Speaker, I beg to give notice that at the next meeting of the House, I will move the following motion. Be it resolved that the report of the Ethics Committee of the House of Representatives on its deliberations on the motions for exemption brought on behalf of the Members of Parliament for St. Andrew Southern, Clarendon Northern, and St. Elizabeth Northeastern, which were laid on the table of the House on the 17th day of November 2020, be approved. Madam Speaker, I further beg to give notice that at a later stage today, I will move for the suspension of the standing orders to enable me to take this motion. Thank you, Madam Speaker.
Thank you. Questions and answers to questions?
Madam Speaker, the Minister of Local Government and Member of Parliament for Western Kingston is available to answer the questions posed at him.
Madam Speaker, could the Minister answer the questions that have been tabled in manual?
Honourable Minister.
Thank you. Thank you, Madam Speaker. In response to the questions, can the Minister confirm if the government had entered into a contract to acquire new fire brigade trucks and pumpers? Response, yes. If the answer to part one is in the affirmative, will the Minister please state the terms of the contract to include the following? The contract provided for 30 Rosenbar Timberwolf apparatus body mounted on an international four-door commercial chassis. The vehicle will be built according to the specification and any agreed upon changes at the pre-construction meeting. Contract sum in total and per unit cost. Response, the contract sum is US $23,717,197.50, inclusive of spare parts and all taxes and fees and other costs per unit is $790,573.25. However, the basic costs per unit excludes spare parts, taxes, and fees is $562,008.48. Company contracted. Response, National Safety Limited, the local dealer for the supplier. The method used, direct contracting. Can the Minister state the rationale for the contract system that was used? Response, over the past 13 years, the GFB has gone to competitive bidding for provisions of fire trucks for its firefighting operations. On each of these occasions, National Safety Limited has won the bid, with the trucks being provided by Rosenbar America LLC. The JFB currently has 39 trucks in its fleet, 37 of which are international trucks, which were bought from Rosenbar America LLC through its local dealers, National Safety Limited. This accounts for 95% of the fleet of the Jamaica Fire Brigade. The majority of trucks are 13 years, and on a daily basis, approximately 4 fire stations are without adequate fire coverage. Procurement of the 30 trucks by the way of direct contracting would serve to standardize the fleets. Madam Speaker, the standardization of the fleets would also lead to a reduction in the maintenance costs of spare parts, and spare parts may be procured in greater quantity from suppliers, thereby allowing competitive prices. Also, parts for these vehicles are readily available on the local market from multiple suppliers rather than just one local dealer. This would provide greater flexibility in securing service parts for the maintenance and servicing of these trucks. Standardization also allowed the JFB to conduct servicing of the fleets with greater efficiency, as the same set of diagnostic tools and equipments can be used. In addition, the JFB in-house mechanics are experienced in servicing these types of fire pumpers. Can the Minister confirm if the board of the Jamaica Fire Brigade was involved in the contract negotiation and approved this contract? Response: the board was not involved in the negotiation of the contract, but the board was kept abreast with the process at the monthly board meetings throughout the entire process. Can the Minister confirm if the Jamaica Fire Brigade was in discussion or negotiations with another company in relation to acquiring new engines? Response: the JFB was not in negotiation with another company in relation to requiring new fire engines. However, the ministry received an unsolicited proposal from E&K Agency, the local representatives of Magas out of Germany, for 35 trucks, 2 wreckers, 2 water tankers, and other firefighting equipment. This proposal was received following a correspondence by the JFB from the said E&K agency that they would not participate in the tender that was issued for the procurement of the JFB trucks. If the answer to part 5 is in the affirmative, will the Minister please state the outcome of those discussions and specifically follow the proposed contract sum per unit cost, whether contract financing was offered to JFB? Response: the proposed contract sum is 14,427,531.41 euros, or 17,024,487.06, including finance charges and excluding all taxes and fees for 30 trucks, 2 water tankers, and the appropriate cost per unit for the fire trucks is 458,353.67 euros, or US 540,857.33, excluding all taxes and related fees. The corresponding approximate cost per unit for the water tankers was 339,071.27 euro, or approximately 400,104.10 cents. Yes, a financing package form was a part of the unsolicited proposal, which inquiry of a sovereign guarantee from the government of Jamaica. A guarantee must be unconditional and irrevocable. And first demand, Madam Speaker, this guarantee is not in keeping with the fiscal rules of the government of Jamaica. However, as previously stated at item 5, the ministry was not in negotiation with any other company regarding the acquisition of fire trucks. Will the minister please state whether personnel from the GFB travel overseas to conduct technical assessment on the type of fire engine most suited for Jamaica? The response, yes. A team from the GFB traveled overseas to a facility to get a better understanding of the technology being used by the company and its capabilities in manufacturing, firefighting, and emergency response vehicles and equipment. Madam Speaker, in accepting this invitation to travel overseas, the GFB was very clear in their acceptance that this undertaking should not be in any way construed as a commitment to do business with that entity, Madam Speaker. If the answer to part 7 is in the affirmative, will the minister please state where the personnel went and what was the technical recommendations? Response. 3 representatives from the GFB traveled to Germany where they visit an installation plant. The team reported that the suppliers may be considered for future procurement and use within the GFB. They noted, however, that the proposal would hinge the GFB to a monopoly agreement with E&K agencies for the servicing and procurement of parts for parts of this type of product. Therefore, any consideration must be looked at carefully as it relates to supporting service for the parts and labor after procurement. What is the difference in the per unit cost for each truck between the contracted company and the other company, which is the GFB, which the GFB was in negotiation? Response. As stated in the response to question 5 and 6, GFB was not in negotiation with another company regarding the acquisition of fire trucks. However, based on our review, the difference per unit price for fire truck between the contracted company and that cited in the unsolicited proposal is approximately $21,151.12 US dollars, including all taxes and fees. Madam Speaker, the difference is also attributable to the difference in the specification of the trucks, and that the ones bought off the shelves from Rosenbauer pumpers are customized to the JFB specification. This is important given the geographical and local conditions of Jamaica's environment.
Madam Speaker, I want to draw the minister's attention to the final answer given on question 9, where he has indicated that the difference between the contracted company and the unsolicited bid is approximately $21,000 US dollars. But if you look on the answer on question 1, The response to question 2, on page 1, the response to question 2A, the per unit cost is $790,000 US. This is for the contracted company. And on page 3, the answer to question 6A is $540,000 US. By my maths, that works out to be approximately $250,000 US based on the minister's own answers. So I don't know how we would conclude that it is only a $21,000 US difference. And I think that needs to be clarified, Minister. Secondly, the issue here revolves around the significant disparity between the unsolicited bid and what is the contracted sum and the methodology used. $250,000 US per unit. When you multiply that by the 30-odd units and you put that in Jamaican dollars, we're talking about a difference of 1.3 billion Jamaican dollars. Now, the question that has to be answered is, in an environment of scarce resources, severe constraints brought about by COVID and other reasons, whether there is sufficient justification for using direct contracting under emergency methods where there's a difference of 1.3 billion Jamaican dollars. And I've seen the justification about standardization and the potential savings, but there must be some cost-benefit analysis done to determine whether that justifies going this direct contracting route. I've heard the minister state that there was no negotiation, and maybe we're using semantics, but if you are in discussions with a company over 1.5 years to 2 years back and forth with exchanges of correspondence, multiple meetings, you authorize and send a team to go abroad to look at the product being offered by the company. Even though you say you're not in negotiations, that is certainly more than a dalliance. And I would think the company would conclude that the ministry was attempting to at least engage it. So a couple of questions, Minister. Was the National Contracting Commission, when they authorized the direct emergency contracting, told of the unsolicited offer from this company? That's the first question. Secondly, I found it strange that the board of the fire brigade would not have been involved with the negotiation of the contract, given that the board has direct responsibility for the procurement of these fire trucks and would have been in detailed discussions and would have the experience. So I'd ask those first two questions of the minister, and then I have some follow-up after.
Madam Speaker, in response to the so many follow-up questions, let me make the point that it would not be the first time that representatives from the Jamaica Fire Brigade would have ventured overseas to examine our vehicles. It has been the norm for the Jamaica Fire Brigade to do so. So there's nothing unusual about that aspect of it. And I also want to make the point, which is very important, that the brigade has indicated to the concerned party that the government of Jamaica will not entertain. It is not a part of the fiscal policy to entertain unsolicited offer. And that was translated to the individual in writing. So let me make that point clear. Fire trucks are not something that you walk into a supplier and buy off the shelf. Those trucks has to be built to specifications. And those specifications are laid down coming from the National Works Agency, which works closely with the Jamaica Fire Brigade to come up with those specifications. So those specifications of the truck would cost more because of the demand, as I said, based on the Jamaican terrain when it comes onto the trucks. You also raise the question of whether or not the contract process, all the details in terms of the requirements was submitted to the contracts committee, and the brigade did in fact made all the requisite submission and got the approval in order to undertake the purchasing or the engagement of the company. The Jamaica Fire Brigade, and this is not since now, the board has never been involved in negotiations for the purchase of trucks before. So this is not something new. This has been the norm at the Jamaica Fire Brigade. So I think I have been able to respond to...
Can you, the first question, and I know I asked a number, the difference in the costs, as I said on your answer to 2A, is $790,000 for the contracted sum, and the 540 on the answer to 6A. By my calculation, 250,000 difference.
Did you see that aspect of it, where we did? And also, you must remember that some of the costing there was not just for fire trucks. There were other proposals that were made, okay, in the costing.
I think what we have to guard against, Minister, given the large sums of money involved here, to continuously use, based on the rationale of standardization, direct contracting, in essence, guarantees a single provider a contract in perpetuity. And the question must be asked whether that provides the greatest value for money for taxpayers, because generally we have found where you have competitive bidding, you tend to get a better offer and better terms for the taxpayers of the country. But based on standardization and the route that is being traveled by the ministry, you will have one entity that will always be contracted directly for the provision of these trucks.
Madam Speaker, I hear my colleague from across the floor, but I want to make the point that the concerns raised by this company, they indicated by letter to the Jamaica Fire Brigade that they would not be interested in participating in a tender process because the trucks that we are using, they are not the agent for those trucks, so they would not participate in that process. And let me say, member, it is clear that for years the Jamaica Fire Brigade has been starved of the necessary equipment to fight fire. And I trust the integrity of the men and women of the Jamaica Fire Brigade. The process was followed. They adhere to the laws to the last T. And I am saying that if you find that there are some level of weaknesses, and I don't say a monopoly on this, because if you go around and look, and let me give you an example. Rapid Response brought in some trucks in this country many years ago. What has become of those trucks? It's not distraction. Let us not try to throw cold water on the effort to equip the Jamaica Fire Brigade to respond to the needs.
Minister, the issue of the need for fire trucks is not in question, neither the expenditure. Every single one of us in this room can argue in our own constituencies that we need fire trucks. So that is.
So you would find the difference in cost. And let me say, member, the Jamaica Fire Brigade, if I give you the history, which I will not, how we got to where we are for 30 trucks. And I want to give credit to the Minister of Finance who provided the resources at a time when it was badly needed. So, member, I will take on board what you have said, and if you feel that there are more questions, but what I don't want, member, is for the country to believe that there is some hanky-panky in providing these trucks for the Jamaica Fire Brigade. It would be a sad reflection on us as a country when we are doing what is necessary to safeguard the interests of the Jamaican people, that it is clouded in any uncertainty. And this transaction is not clouded in any uncertainty. It has been open and transparent.
Madam Speaker, I beg to give notice that at the expiration of 21 days, I'll ask the Prime Minister the following questions tabled in my name.
Motions for leave to introduce bills. Presentations of bills without leave of the House first obtained. Public business.
Madam Speaker, there are a number of matters that are to be taken in public business, the order of which, Madam Speaker, I'm seeking your concurrence to revamp a little so as to facilitate the leader of the opposition who will participate in what will now become the first item for debate and then to leave therefrom. So, Madam Speaker, would you invite the Minister of Finance? Yes, I know what we're going to do. Madam Speaker, I ask that you invite the Minister of Finance to commence the debate on the Bank of Jamaica Amendment Act 2020.
Minister Clark.
Yes, we do them afterwards. But they're all long.
Madam Speaker, I rise to open the debate on the Act to amend the Bank of Jamaica Act. Madam Speaker, the principles for modernization of the Bank of Jamaica outlined in this bill to amend the Bank of Jamaica Act are in keeping with modernization of other central banks, which have led to greater transparency, independence, and accountability in the conduct of monetary policy, ensuring for better economic outcomes. The legislative changes that are to be made with this bill are in the context of other changes made over recent years for the modernization of the Bank of Jamaica in keeping with international best practices. Madam Speaker, recent amendments made include the strengthening of the supervisory autonomy of the Bank of Jamaica with the passage of the Banking Services Act that replaced the previous Banking Act, the Financial Institutions Act, and sections of the Building Societies Act in 2014. In 2015, there were also amendments made to the Bank of Jamaica Act to expand the bank's mandate to include responsibility for the maintenance of financial system stability. This Honourable House, Madam Speaker, will recall that the bill that I opened the debate on today was first tabled 2 years ago in October of 2018, and it was subsequently referred to a joint select committee of Parliament. Madam Speaker, considering the magnitude of the bill in terms of its impact and its long-standing effects, I felt it best to move for the establishment of the committee in order to fully ventilate all aspects of the bill, as well as give all Jamaicans the opportunity to participate through providing feedback. The Joint Select Committee had extensive deliberations and made recommendations which were accepted and are incorporated in this bill, which was tabled a few weeks ago. Madam Speaker, before I go through the main provisions of the bill, I'd like to pause to sincerely thank all members of the Joint Select Committee from both Houses of Parliament, from both sides of the aisle, who sat and deliberated, who listened to points of view brought by the union movement, by the various private sector groups, by the banking sector, by civil society, by others in the regulatory environment, by the BOJ, and considered those views and debated among ourselves. I must say, Madam Chair, that the spirit of the Joint Select Committee was one that was positive, and that has resulted in a better bill. And indeed, there were the composition varied from meeting to meeting, and it didn't matter. The spirit was maintained throughout. And I recognize the member who is the opposition spokesperson for finance for his role and for the roles of others who sat on that committee. Madam Speaker, the bill is designed to, and of course, to thank the Attorney General's Chambers and the Chief Parliamentary Counsel's Office, the staff from the Ministry of Finance and from the BOJ who provided the technical services and input to the amendments to this bill. Madam Speaker, the bill is designed to modernize and strengthen the central bank. A robust, strong, transparent, accountable, institutional framework for a central bank is consistent with national economic well-being. This bill, Madam Speaker, clarifies the mandate of the central bank, provides for capitalization, adequate capitalization of the central bank, and institutes a modern and robust, accountable, transparent institutional framework. It minimizes the prospect of fiscal dominance, as we have had in Jamaica's past, by restricting conditions on which the GOJ can borrow from the central bank and their amounts. Madam Speaker, I just want to mention that in preparation for this bill, in 2 previous budgets, the government of Jamaica would have capitalized the central bank to the tune of approximately 50 billion Jamaican dollars. $33 billion in capital to replace losses, prior year losses of the central bank, and 20.6 billion in new capital. That's 50 billion over 2 fiscal years. And Madam Speaker, it's a good thing that we did it, and we did it at that time. When the pandemic hit Jamaica earlier this year and asset prices began to fall and banks, customers of banks no longer were necessarily paying on time, obviously with the forbearance that was given, liquidity became an issue. And the central bank was able to inject over $50 billion of liquidity into the system by their own, I'm just paraphrasing what I've heard the governor say, by purchasing bonds from financial institutions. And by purchasing those bonds, which are assets that they held, they, by virtue of doing that, injected cash into the system, which has allowed for Jamaica to absorb the pressures that have come from this crisis. And that wouldn't have been as easy had we not capitalized the central bank in the way that this bill envisions that we do and we maintain. So therein, Madam Speaker, even before passage of the bill, a fundamental practical benefit that we have all benefited from, Madam Speaker. So I turn now to go through some of the main provisions of the bill. Clause 2 seeks to amend the interpretation section of the Act by amending the definition of certain terms and introducing the definition of other important terms, including monetary liabilities and marketable securities. Clause 3 contains the definition for a fit and proper person, which is the critical criteria to be satisfied by the officers and directors who play a significant role in the administration, management, and decision-making of the bank. Clause 4 seeks to repeal Section 5 of the Act in order to clarify the principal mandate and objectives of the central bank. The clause explains that the principal objectives of the bank are price stability, financial system stability, with the primary objective being the maintenance of price stability. It should be noted, Madam Speaker, that in pursuit of these objectives, the bank should ensure that it is done in a manner that recognizes the growth and employment objectives of the government. Clause 4 seeks to amend Section 6 of the Act in order to clarify the responsibilities of the Board of Directors of the bank. It also amends the section by stipulating how directors are appointed and terminated. Madam Speaker, there will be 5 non-ex officio, i.e. non-executive directors who will be appointed by the Governor General in Council. In addition to the 5 appointed directors, the board will consist of 3 ex officio directors, the Governor, the Senior Deputy Governor, and 1 Deputy Governor appointed by the Governor General in Council on recommendation of the board. The clause also contains provisions to clarify what the remit of the board should be in relation to the decision-making process of the bank and the work of the statutory committees. It should be noted that the Financial Secretary will no longer be a member of the board. These amendments are important in order to achieve greater independence of the bank from undue external influence on its operational and policy decision-making processes. Clauses 6 to 9 seek to amend Sections 6A to 6D of the Act to stipulate how senior executives of the Bank of Jamaica are appointed and terminated. It details that the Governor will be appointed for a term of 5 years and may be reappointed. The Senior Deputy Governor will be appointed by the Governor General in Council on the recommendation of the Board, and other Deputy Governors will be appointed by the Board on recommendation of the Governor. The tenure of appointment of these offices will be for a term not exceeding 5 years. The clause also clarifies who is authorized to determine the terms and conditions and the emoluments associated with such appointments. Clause 6 seeks to amend Section 8 of the Act, which speaks to the capital of the Bank of Jamaica. This section is being amended to increase the capital as stated in law from $4 million to $20,577 million, consistent with the objective of ensuring that the capital of the modernized BOJ would be at all times equal to at least 5% of its monetary liabilities based on its 2018 year-end audited financial statements. Madam Speaker, this clause also contains amendments to remove the concept of an authorized capital for the bank from Section 8, subsection 1 of the Act. The amendment to subsection 3 stipulates that the capital of the bank provided for at subsection 8, subsection 1 may be increased by a resolution passed by the House of Representatives. Clause 13, Madam Speaker, seeks to amend Section 9 of the Act, which stipulates that the BOJ is obliged to establish and maintain a reserve fund into which the net profit of the bank, after allowing for specified contingencies, is to be deposited. This section is being amended to stipulate how profits and losses of the bank will be addressed. The amendment seeks to redefine Bank of Jamaica's statutory capital in the law to be dynamic, with its adequacy determined in relation to its monetary liabilities. As such, it stipulates both a lower and an upper threshold for statutory capital. The proposal defines a lower threshold at 3% of monetary liabilities, below which recapitalization of the bank by the government is required, and an upper threshold of 8% of monetary liabilities, above which all realized profits would be distributed to the government. Madam Speaker, this amendment will ensure that the central bank is financially independent and that it will be provided with the financial resources, thus safeguarding the strength of its balance sheet in order to fulfill its mandate and be allowed the autonomy to manage its internal affairs. It should be noted that in the event the bank's statutory capital as defined were to fall below 3% of monetary liabilities, the government has 6 months from the start of the fiscal year within which to issue marketable securities. Also, in the event that the securities were not issued by the government within that period, there are provisions which stipulate the responsibility of the board to notify the minister and the Speaker of the House of Representatives. The clause also includes provisions to indicate the amounts of distributable earnings which should be paid to the government in different circumstances. In particular, no distribution should be made where statutory capital falls below 5% of monetary liabilities, since that threshold represents the target level for the bank's capital. Clause 14 of the bill, which addresses the powers of the bank to grant temporary loans and advances to financial institutions, seeks to amend the Act by amending the proviso to Section 23, subsection F of the Act to reflect the risk characteristics of the collateral provided instead of the cap of 75% of current market value of the collateral in the case of securities issued by the government or other governments, bills of exchange, and promissory note. Clause 16 amends the Act by the insertion of the new parts VAA and VAB of the Act. The amendments in this clause allow for the establishment of statutory committees, which are collective decision-making bodies. It also stipulates that proper governance and accountability mechanisms are to be in place to allow for appropriate reporting relationship with both internal and external stakeholders of the committees. The new part with the Monetary Policy Committee being operationally responsible for achieving this target. To ensure transparency surrounding the setting of the inflation target, it should be noted that the part contains provisions to notify Parliament within 14 days once the target has been set. There are also provisions for the publication of the target on the Ministry's website. The part also contains provisions to ensure transparency and accountability of this committee by requiring reporting and publication of policy and decisions of committee meetings. The Monetary Policy Committee will play a key role, Madam Speaker, and it will have a responsibility to report and to make the minutes of its deliberations available to the public for scrutiny at a fixed period after the date of such meetings. At the moment, the mechanisms for the responsibility that will be given to the Monetary Policy Committee are in the response of the governor. And this kind of broad-based, accountable and transparent setup does not at the moment exist. The new Part 5AB contains a provision for the establishment of the Financial Policy Committee. The part stipulates the composition of the committee, protection of the members, secrecy provisions relating to members, and the functions of the Financial Policy Committee. There are provisions to this part to stipulate the conditions by which the appointment of members of the committee can be revoked by the Governor-General in Council, providing that this shall be on the recommendation of the board of the bank. The Financial Policy Committee will have responsibility for financial policy, including policies and procedures for prudential supervision, macroprudential policies, payments and settlement system policies, policy matters arising from statutory mandates or delegated by the Minister of Finance relating to remittances, cambios, and credit reporting, and any other financial policy matters for which the bank is given responsibility. Clause 17 seeks to amend Section 34H of the Act to ensure consistency with provisions for the two new committees, the Monetary Policy Committee and the Financial Policy Committee, which are proposed to be inserted in the Act. Section 34H contains provisions for the Financial System Stability Committee, and one of the proposed amendments is to ensure that appointed members of the committee are not directors of the board or members of another statutory committee where this would result in more than one member of the committee being a member of another statutory committee, or a member of any statutory committee being on more than 2 statutory committees. There are proposals for other amendments to Section 34H, including the insertion of provisions for fit and proper assessment of Financial System Stability Committee members, updating terms including public body, insertion of provisions a provision which speaks to the remuneration of FSSC members, similar to those of the MPC and FPC. Clause 18 seeks to amend Section 34M of the Act by making reference to Section 23, subsection 4 in paragraph B. It also deletes current paragraph D and replaces it with a new paragraph D to reflect that in the event of a threat to stability in the financial sector, notwithstanding the restrictions provided for at Section 23, subsection F, the conditions under which the Bank of Jamaica can provide emergency liquidity assistance to financial institutions. Clause 19 repeals and replaces Section 36 of the Act, with provisions that stipulate the establishment of reduced limits on credit that the bank can provide to the government and the public sector in any fiscal year where there occurs an event declared as a national emergency. Please note that this clause stipulates that the minister responsible for finance would be responsible or would be required to declare such an emergency for the purpose of this section. This declaration will be done by order subject to affirmative resolution. Clause 20 repeals and replaces Section 37 of the Act with provisions that limit the power of the bank to purchase securities or guaranteed by the bank. It also introduces restrictions on acquisition by the bank of securities in the secondary market if this would circumvent the limits on acquiring securities at primary issuance. The clause also stipulates exceptions under which the Bank of Jamaica can purchase or acquire on primary issue securities issued by the Bank of Jamaica. Clause 21 of the bill repeals and replaces Section 41 with provisions that limit the power of the minister to give directions to the bank. The clause provides that the minister cannot issue directions to the bank in relation to monetary policy or supervisory matter. In many ways, that's a key plank of the bill. This is to ensure operational independence of the bank in the conduct of monetary and financial policy. Clause 22 repeals and replaces Section 43 of the Act. The provisions in this clause give details on the preparation and audit of the financial statements of the bank. Clause 23 amends Section 44 of the Act by inserting a new subsection 2A, which details a time frame within which the governor should submit reports relating to the performance and main activities of the board and committees of the bank. It also gives details about the tabling of the report in the Houses of Parliament. After tabling, the report is referred to the Standing Finance Committee of the House of Representatives, and the governor should make himself or herself available to present the reports and to answer questions before that Committee of Parliament. These provisions are to ensure greater accountability and transparency. So, Madam Speaker, the central bank is accountable now to the people of Jamaica through the Parliament. Not accountable to the Minister of Finance, accountable to the people of Jamaica through the Parliament. And the governor will be required to appear in Parliament and in the Standing Finance Committee of Parliament and take questions from the representatives of the people from across the length and breadth of Jamaica. Clause 24 of the bill amends the Act by inserting a new Section 45A, which stipulates that the bank has to comply with the governance rules set out in the second schedule. The schedule contains similar provisions as the Public Bodies Management and Accountability Act are as applicable to the Bank of Jamaica Act. So there are specified regulations for the BOJ which borrow from the applicable portions of the Public Management and Accountability Act. Madam Speaker. Clause 25 amends the Act by inserting a new Section 50A, which describes enforcement provisions in the event that there are contraventions. Clause 26 of the bill amends the schedule of the Act. The amendments to the schedule include provisions relating to the tenure of office for the 5 appointed directors of the board. It should be noted that the tenure of the directors will be for a period of 10 years. It also provides for staggered appointments for these 5 directors, which would stagger across political cycles. In the transition period, the directors will be appointed for a period of 10, 8, 6, 4, and 2 years respectively. Only these directors will be eligible for reappointment. After this transition, directors who serve a full term of 10 years will not be eligible for reappointment. The amendments also specify that persons employed in the government, public body, or employees of the bank are not eligible to be an appointed member of the board. So under the Public Bodies Act, under the regulations, the term of directors is limited to 2 terms. And similarly here, it would not be longer than that period. The clause also includes other provisions relating to the resignation of executives of the bank and termination of the appointment of the directors of the board. Clause 27 contains provisions for the insertion of the new second schedule, which contains the governance rules for the Bank of Jamaica. As indicated before, the rules are similar to those in the PBMA, but with appropriate modifications as are applicable to the central bank. Clause 28 contains the provisions for the consequential amendments to the Banking Services Act, the Procurement Act, the Public Procurement Act, and the Public Bodies Management and Accountability Act. Madam Speaker, the amendment, in concluding, the amendment to the Bank of Jamaica Act is an important step to modernize Jamaica's monetary apparatus, specifically the Bank of Jamaica, through clarification of its mandate and enhancement to its governance structures and maintaining a dynamic capitalization of the central bank, allowing it to have sufficient capital to carry out its mandate. Madam Speaker, the amendments seek to bring greater independence to the operations, to the Bank of Jamaica in its operations and policy decision-making process, while at the same time ensuring transparency and accountability through adequate governance arrangements. Madam Speaker, this is a most important bill as far as strengthening the financial architecture of Jamaica. And I thank all who have contributed to it in the Joint Select Committee, and I commend the Bank of Jamaica Amendment Act 2020 to this Honourable House for approval.
Thank you, Madam Speaker. Madam Speaker, this bill has been in the Parliament, I think, a little over 2 years. It was retabled, obviously, after the election, but essentially it's the bill which was reviewed by a Joint Select Committee and amended extensively in light of the deliberations of the Joint Select Committee, and I want to join the Minister in thanking all those who participated in that process. It was a very useful exercise. I think it brought a number of important enhancements to the bill, which make it a better piece of legislation for Jamaica. The Minister has outlined the main provisions. I don't propose to go through them at all. I would only ask that the Minister of Justice, who I don't think is in the room at the moment, do his utmost to produce the consolidated Bank of Jamaica Act through the law revision process, which is a process that's an ongoing process that consolidates amendments to legislation into the existing principal acts to produce one document that is easily read. Because any person attempting to understand this in its present form is going to find it a challenging exercise. It's a very technical document, and it's amending provisions in another document extensively. So when that law revision exercise is complete, we'll have a consolidated Bank of Jamaica Act available to the public in the laws of Jamaica. I don't know where they've reached now in terms of how current they've brought the laws, but I hope this won't take a long time. Madam Speaker, one of the main objectives of this piece of legislation is to establish inflation targeting in law in Jamaica. In practice, it had already been commenced because the government set an inflation target during the period prior to this bill being produced and tabled, but it wasn't provided for in any legislative framework. And this bill now enshrines inflation targeting as one of the principal, really the principal objective of the Bank of Jamaica. This is a very important issue because that was not previously the primary role of the central bank, at least not explicitly. So clause 5, section 5 of the Act, as amended, will now read, the principal objectives of the bank shall be the maintenance of price stability and financial system stability, with the primary objective being the maintenance of price stability. So price stability, financial system stability are the two main objects, but price stability is the primary one. One concern I had with the bill in its original form was that it didn't make any reference to the wider economic interests of Jamaica. It was narrowly focused on those two issues. And in the course of the Joint Select Committee deliberations, an additional provision was added, which is actually subsection 4 of section 5. And this didn't exist in the bill as it was tabled, but it is now in the bill that we're hopefully going to pass today. And it says, the bank shall carry out its functions with a view of achieving the principal objectives specified under subsection 1, and shall do so in a manner that recognizes the growth and employment objectives of the government. So it ties the Bank of Jamaica's thinking into alignment with the growth and employment objectives of the government. So yes, there's independence, but there should be synergy in how you roll out and apply the powers given to you as a central bank. And this was an important provision added to the bill. One concern I have, and I think that, in my view, it is a weakness in the bill, that's a personal opinion, is the manner in which the inflation target is set. The inflation target, which is a range, is a very critical economic decision taken by the Minister of Finance, because the Bank of Jamaica will now have as its primary objective ensuring that that target is achieved. And the way in which they do that is through how they roll out monetary policy, how they affect liquidity in the economy, the money that's flowing in the economy, interest rates, and so forth. So that target is vital to economic outcomes in the society. Many countries have a target of roughly 2% as the normal inflation target. That is the standard. In Jamaica, we're a bit higher. We're a developing country, and we're coming from a particular background and so on. So we're in a range of 4 to 6. And the Bank of Jamaica has been, even through the pandemic, has been managing liquidity and so forth to ensure that that inflation target is maintained. I would have liked to have seen a more transparent process in the setting of the inflation target, because it is the most critical target, perhaps, that's set in the economy. What the bill does say is that once it is fixed by the minister, a notice of it is tabled in the House. But I would have preferred, at minimum, if it provided for the minister to set it the Parliament's input in a debate on that decision. The other point I want to make in this brief presentation has been alluded to by the minister, and it relates to the second schedule, the governance provisions. This, again, is an important enhancement that resulted from the Joint Select Committee process, because the original bill had an exclusion of the Public Bodies Management and Accountability Act from applying to the Bank of Jamaica. But there wasn't, in my view, sufficiently robust provisions around ensuring accountability and oversight of the Bank of Jamaica's internal financial arrangements and accounting arrangements. the Minister agreed, and we adopted essentially the relevant provisions from the PBMA, modified them appropriately so they apply in a cohesive way to the Bank of Jamaica, and reintroduced them through the second schedule. And I think that's important. For example, the Auditor General has powers to audit the Bank of Jamaica if something is going awry. And yes, independence of the central bank is a key objective, but the purpose of that independence is to ensure that monetary policy is professionally managed and is not subject to the controls or whims of the political directorate of the government. But in terms of the accountability structures of the public sector, it is important that the Bank of Jamaica be subject to the same levels of potential oversight from an office such as the Auditor General as any other public body. And that was accepted and included in the bill through the second schedule. So, Madam Speaker, this legislation represents a continuation of the reforms of the central bank that have taken place over the last 8 years, and maybe before. There were some important reforms that were done under the last administration of which I was a cabinet member, and this is a further important reform. The recapitalization of the bank has been a result of the beneficial effects of the fiscal program that Jamaica has been committed to since 2012, coming right through to 2020. And the enhanced revenues that have been generated by the structural reforms of that, which have enabled the government to commit, as the Minister said, 50 billion of capital to the central bank over 2 fiscal years, I think, which has strengthened their ability to execute monetary policy effectively. So, Madam Speaker, we support the bill. We worked collaboratively on it. I think the Joint Select Committee exercise was definitely beneficial to the process. It has taken a little longer than I think the Minister anticipated when he first tabled it, but that's the nature of things here. At the end of the day, hopefully, if life spared, the bill will be passed before Christmas and become law. And we will have achieved a significant milestone, further milestone in ensuring the independence and modernization of our central bank, which of course is a most critical institution in the economic affairs of the Jamaican society. So, Madam Speaker, the bill has our support. Thank you.
Thank you.
Madam Speaker, the member who was on the Joint Select Committee has alluded to some of the key issues that would have dominated or the time of the committee. And in the end, in the committee, we would have resolved all of them, not necessarily all of them to liken of any one person consistently, but we were able to find common ground overall. With respect to the mandate of the central bank, the member is correct that this is, price stability is about trying to achieve a particular inflation target, and this has started a couple of years ago. In 2018, we formally started inflation targeting, prepared for it shortly before that, and the bill seeks to institutionalize it. And one thing that has been, sort of underappreciated, but it shouldn't be, is that under the precautionary standby arrangement, a large part of the focus under the PBSMA, under the precautionary standby arrangement with the fund, was on enhancing the monetary framework, which is as the member alluded to, a very, very technical and therefore not as readily transmitted through media as, paying down debt, primary surplus, you can't spend more than you earn, etc. But we underappreciate to the, it ought not to be, Madam Speaker, because we can make progress on the fiscal, but if we don't have the framework to ensure that we have low and stable inflation through our monetary institutions, then the work on the fiscal will go to waste. And a large part of what transpired over the past 3 years has been on making that transition to an inflation targeting regime. Now, you can only have an inflation targeting regime if you have flexible exchange rates. And you know, I don't want to go into that, you know, that took a huge political capital in terms of addressing that. So when everybody speaks about the fund program, what was achieved and what wasn't achieved, it should not be lost that the move towards inflation targeting is a move, obviously, that depended on progress that collectively we have made, but that would have been a central focus under the precautionary standby arrangement. And it's for the good of Jamaica. We have made progress in that regard, and inflation targeting, you know, has become a reality, and the bill institutionalizes it. With respect to the setting of the target, as the member mentioned, we had a lot of debate about that, and where we settled was that it wasn't like that before Joint Select Committee, and where we settled in Joint Select Committee that the minister, table it in Parliament. On the PBMA, again, what we did was the Bank of Jamaica falls today under the regulations of the Public Bodies Management and Accountability Act. But there are many provisions of that act that are not suitable for the BOJ. For instance, the PBMA may say audited accounts should be done 90 days after the end of the year. Well, for a central bank, that's not good enough. You really want your audited accounts in 60 days. That's a trivial example. So you're better off having regulations that are designed specifically for the central bank. In addition, because the PBMA deals with 140 public bodies, we often update the PBMA for issues that arise, and in so doing, not recognize that the BOJ is a part of it and end up having additional regulations in the PBMA that are not really applicable to the central bank. For example, so for that reason, we have amended, as a part of the bill, we have the regulations under which the central bank would fall. And the committee, would have made a big input in ensuring that we pass them at the same time, that we didn't pass the act and then forget about the regulations, and then we have a weakened apparatus, weakened system. So I thank the committee for that intervention as well. Madam Speaker, I now ask for a second reading of the bill.
The question before the House is that the bill be read a second time. Those in favor? Those against? The ayes have it.
A bill entitled An Act to Amend the Bank of Jamaica Act, read a second time.
Members, the House will now resolve itself into a committee of the whole House to consider the bill. Clause by clause.
Madam, can I make a move a motion that we put all clauses together?
There are no changes.
Those in favor of doing that? Aye. The ayes have it. I now put clauses 4 to 29. Those in favor? Aye. The others, and I put 1 and 2. 1, 2, 3. No, these are this. No, madam. Members, I also put clauses 1, clauses 2, and clauses 3. Those in favor? Ayes have it. I put the title and the enacting clause. Those in favor? Those have it. Members, the question is? Members, the question is that I do report the bill as having passed committee stage without amendments.
Madam Speaker, I now ask that the bill be read a third time.
The question is that the bill be read a third time. Those in favor? Aye. The ayes have it.
A bill entitled An Act to Amend the Bank of Jamaica Act, read a third time and passed.
Bill passed.
No. So there's order in the house. Sit down. It's a dog, man. Don't be so doggish.
Madam Speaker, there is a concern that the member who had carried his motion on the Dogs Liability Act, and we had actually reached the committee stage, that if there's no further debate on the matter, it will go strict to the to committee and to be just dealt with there. Then we would take that just ahead of the Shipping Act, which will be taken
House
by
Leader,
the Minister.
it had passed committee stage.
No. The debate, so it's just committee stage. So, yes, Madam Speaker, so we will now invite you to do the necessaries in that regard.
No. The House now, member, will resolve itself into a committee of the whole House to consider the bill, clause by clause.
Madam Speaker, there are a few amendments, and the clerk, not the clerk of the House, sorry, who can just distribute those who would like to see some of the few amendments.
Member, the amendments have been distributed.
Have been distributed, very well. Anyone who has not got a copy of the amendment could get a copy. But you please proceed, Madam Speaker, Madam Chairman.
Members, I put clause 1. Those in favor? Those against
One
it?
second, give me my.
I put clause 2.
Madam Speaker, there are some changes to clause 2. Firstly, we would like to delete the definition of attack and substitute the following definition. Attack means any circumstance which results in injury instead of what is presently there. So we are going to remove the present definition of attack and put in its place attack means any circumstance which results in injury. And also in the definition of injury, we delete the definition of injury and substitute the following. Injury means injury to an individual and includes death, disease, or any impairment of an individual's physical or mental condition. And B in section 5 also includes injury to any animal. Those are the proposed changes to clause 2, Madam Chairman.
Members, I now put clause 2 as amended. Those in favor? Those against? The ayes have it. I now put clause 3. Those in favor?
Aye.
Those against it. I now put clause 4.
Madam Speaker, one change in clause 4. We will, in subsection 1B, delete the word and substitute, therefore, the word or, which means, Madam Speaker, that the section will be disjunctive rather than conjunctive.
Members, I put clause 4 as amended. Those in favor? Those against? The ayes have it. I put clause 5. Those in favor? Those against?
Aye.
The ayes have it. I put clause 6. Clause 8. Member?
Madam Speaker, clause 8, I would just like to, in subsection 1B and 1C, by inserting next after the words $are, the words open quotation, in default of payment of the fine. So in both subsection 1B and 1C, we are going to insert after the words dollars are in default of payment, which, Madam Speaker, means that it is a fine that is being imposed, but in the failure to pay a fine, then there is an alternative of an imposition of an imprisonment. So it's not an imprisonment that is intended, it is a fine. But in default of payment of a fine, it is a term of imprisonment. And Madam Speaker, in subsection 2, the following subsection, after subsection 2, subsection 3, for the purposes of the Criminal Records, quote, Rehabilitation of Offenders, close quotation Act, an offense under subsections 1A, 1B, or C, or section 10.5 shall not form part of the criminal record of the offender. What this means, Madam Chairman, as I said in the debate, is that these offenses are not meant to impose or to have offenders having a criminal record. These are really deterrent criminal, quasi-criminal offenses. So what this subsection does is to ensure that in the parish courts, the persons who are fined do not have a criminal record.
Thank you. I put the amendment and the clause as amended. Those in favor?
Aye.
Clause 9. Member?
Clause 9, Madam Chairman, in subsection 1A, delete the words put to death and substitute therefore the words humanely euthanize. The idea, this came from the Jamaica Society for the Prevention of Cruelty to Animals, that the words should be appropriately humanely euthanized rather than being put to death.
Members, I put the amendment and the clause as amended. Those in favor?
Aye.
The ayes have it. Clause 10.
Madam Speaker, in subsection 3, we are going to delete A, the words justice of the peace, and substitute therefore the words judge of a parish court, which puts it at a higher level, Madam Chairman, that if in case of any problems, it is a judge of the parish court who will determine rather than a justice of the peace. And in B, next after the words an individual, the words in a public place. And C, insert next after the words authorizing and the constable, the words with the assistance of such persons as may be specified, being persons having the appropriate expertise in the control of dogs, which means, Madam Speaker, in deciding how to deal with the dogs, is not just the constable, but personnel who have some expertise in dog control and how to deal with dogs.
Members, I put the amendments and clause 10 as amended. Those in favor?
Aye.
I put clause 11. Those in favor?
Aye.
Those against? I put clause 12. Those in favor?
Aye.
Those against? I put the title and enacting clause. Those in favor?
Aye.
Those against?
Madam Speaker, may I just for the sake of correction, may I ask that clause 7, can I return to clause 7, Madam Speaker? We had said or should appear at the end of paragraph C. It should appear at the end of subparagraph D, right? So just note it's not at the end of paragraph C because we have renumbered. So or is at the end of paragraph D instead
Members,
of paragraph.
we are revisiting clause 7.
Yes.
So the amendment should not be at the end of paragraph C, but at the end of paragraph D.
Because
those
there's
in
a paragraph
favor?
E.
Yes,
right.
because those in favor?
Aye.
Those against? The ayes have it. Question is that I do report the bill with 17 amendments having passed committee stage. Those in favor? Those against?
Not yet. Madam Speaker, I now ask for third reading of the bill.
A bill entitled An Act to Repeal the Dogs Liability of Injuries Act. A bill entitled An Act to Repeal the Dogs Liability for Injuries by Act and to provide for liability for attacks by dogs and for connected matters, read a third time and passed.
The bill is passed.
Madam Speaker, I think you're moving nicely along. Would you ask at this time that the member from Western St. Mary and Minister of Mining and Transport commence the debate for the amendment of the Shipping Amendment Act 2020.
Mr. Montague.
Thank you very much, Madam Speaker. Madam Speaker, it is with a sense of pride that I rise to lay before this honorable House a very important and historic piece of legislation designed to make better provisions for standards and behaviors within the merchant shipping industry nationally and internationally. The Memorandum of Objectives and Reasons, Madam Speaker, is that the Maritime Labour Convention 2006 provides a comprehensive framework for the rights and provisions of seafarers and to ensure decent working conditions for seafarers. A decision has been taken to amend the Shipping Act so as to make more complete provisions for the rights and living and working conditions of seafarers in line with the Maritime Labour Convention. It is expected that these amendments will ensure that Jamaica is able to meet its obligation under the Convention. The Shipping Amendment Bill 2020, Madam Speaker, which was tabled on November 3, 2020, shall be read and taken as one with the Principal Act, the Shipping Act 1998, and will amend some outdated modalities in the statute. Essentially, Madam Speaker, the bill is aimed at making more complete provisions for the living and working conditions, as well as the rights of seafarers in line with the Maritime Labour Convention of 2006. This progressive and groundbreaking legislation needs no debating in my estimation. It is a necessity, especially given the realities that we are currently facing in light of the presence of the coronavirus. This piece of legislation will enable Jamaica as an active member of the international community and a leader in the maritime industry to meet and honor our obligations under the Maritime Convention and give effect to our decision so to do. The new clauses and amendments are the basis for reform, restructuring and transformation within the shipping industry. Indeed, Madam Speaker, the new amendments are consistent with certain international trends and developments. For a start, the bill introduces new definitions and replaces several existing terms in the Principal Act to reflect the language of the Maritime Labour Convention. For example, seaman will be now referred to as a seafarer, and crew agreement is now a seafarer employment agreement. Allied to this is the wider definition of a seafarer adopted to cover any person engaged by or on behalf of a ship, owner of a ship, and includes persons employed in the hospitality division of passenger ships. Madam Speaker, this is truly important for Jamaica, as there are approximately 10,000 Jamaicans working on cruise ships in the hospitality division that are going to benefit immensely from this provision. Madam Speaker, our workers, our Jamaican workers that are employed to cruise shipping lines are not protected by legislation. And finally, having signed the Maritime Convention, Jamaica is now enacting our own laws and that convention into statute so that we can protect the 10,000 Jamaicans who work in this industry. So the household, the room attendants, the waiters, the spa employees, the bartenders who were never covered, Madam Speaker, will now be given protection under the Jamaican law, having also signed the convention. In fact, this amendment could have benefited thousands of hospitality workers we had to bring back home earlier in the COVID crisis. But the passage of this bill will see us moving forward in a more progressive way for these workers. And Madam Speaker, I must pause on behalf of the government and people of Jamaica to thank the cruise lines who took home our Jamaican workers, although they were not obligated by law so to do. And a thankful nation says to them, as partners, we will continue to work together for the betterment of all. Madam Speaker, the framework for the engagement and welfare of seafarers has been enhanced with the addition of provisions governing collective bargaining agreements and establishes the competent authority for the Act as the Maritime Authority of Jamaica. The bill introduces requirements for Jamaican ships of 500 gross tonnage or over to have on board a current maritime labor certificate and a declaration of maritime labor compliance demonstrating compliance with the Maritime Labor Convention. Madam Speaker, this Act also empowers the Minister to grant exemptions by way of publication in the Gazette of a category of ships to be exempted from the provisions of the Principal Act dealing with the engagement and welfare of seafarers. Indeed, Madam Speaker, this declaration of maritime labor compliance and the labor certificate will be issued under the regulations and made under this Act, and the master of any foreign ship shall be required to have it to get clearance for the ship to leave Jamaica to engage in international voyage. In other words, Madam Speaker, we are ensuring that employees on Jamaican registered ships or foreign ships in Jamaican waters must comply to the provisions of the Maritime Labor Convention and give protection, finally, to the workers on these ships. Additionally, the amendments provide a change in the minimum working age from 16 to 18 years. This clause outlines the restrictions on the type of work in which persons under the age of 18 may be employed on board a Jamaican ship. Such person may not be engaged in the engine room unless under supervision, in night work unless with the permission of the authority for a recognized training program, as a cook or any type of work that is likely to jeopardize their health or safety. Night work has been defined as work between the hours of 10 o'clock in the evening and 5 a.m. And the question of whether work is likely to jeopardize the health or safety of a person under the age of 18 is to be settled by the minister responsible for labor, the gentleman who is next to me. Meanwhile, Madam Speaker, in keeping with the modernized labor laws, the bill speaks to provisions of water for seafarers on board as a free commodity. Madam Speaker, some people may just overlook this provision, but the provision of water must be free to our seafarers, and water is a very precious commodity on board a ship. This bill further introduces provision for addressing a ship owner's liability for medical care and burial expenses. It provides that the owner of a Jamaican ship is responsible for the health, protection, medical care of all seafarers working on board the ship, and such medical care shall be comparable to that available to workers on shore. Madam Speaker, too many times, members of Parliament have visitations from their constituents who have been injured on board ships, and there is no recourse. After today, Madam Speaker, that will not be the case in Jamaica, because this caring government, this government that looks out for its people, has made sure that there is protection in law for the workers of Jamaica. Indeed, when we say this government, I include you too, the member from South St. Catherine. The owner is liable for all the cost of medical care in respect of sickness or injury of any seafarer between the date of engagement and repatriation of the seafarer, and where such sickness or injury is attributable to the seafarer's employment on board. Owner shall also be liable for sickness or injury which result in the incapacity of the seafarer to work, and for reasonable burial expenses of any seafarer who dies on board the ship or ashore during the period of the seafarer's engagement. Meanwhile, the bill provides protection for the property of an injured or deceased seafarer which was left on board a ship, and the owner of the ship is required to take reasonable measures to safeguard that property and return it to the seafarer or the seafarer's next of kin. Madam Speaker, this is a very important provision, as we in Jamaica has a lot of respect for those who are departed. And many times the property of the dearly departed is discarded, and sometimes in their personal possession are family mementos that has no monetary value but means something to the family. And this provision protects that, Madam Speaker. The circumstances under which a ship owner may not be liable for injury or sickness of a seafarer are also outlined, as well as the introduction of provisions for financial security for abandoned seafarers in the form of insurance, in which instance the certificate of insurance is required to be carried on board the ship and displayed. Madam Speaker, right here in Jamaica, many times we hear of ships being abandoned at sea or in our ports, and the seafarers are left to the mercy and the goodness of the government of Jamaica. That will be no more, because the ship owners will have to take insurance and they will be responsible for the repatriation of the seafarers if they are abandoned at sea. Since the tabling of the amendments, there are two additional amendments to the bill being moved today. These include an amendment to Section 141 of the Principal Act by deleting the words master or as well as $100,000 and substituting for $100,000 $5 million. Madam Speaker, the reforms outlined are expected to significantly impact workers' welfare and productivity within the maritime industry nationally and internationally. Madam Speaker, it is said, and based on the discussions both myself, the Minister of Tourism, and the Minister of Labour have been having with the cruise lines, that potentially immediately we could see an additional 10,000 Jamaicans being employed shortly after the passage of this bill. Because the cruise lines have indicated to us that they are wary of employing persons from countries that does not codify in law the provisions of the Maritime Labour Convention. So we are taking a very important step today, and I'm sure that there is no member of Parliament in this House that is going to object to the passage of this bill that will see to the employment of more Jamaicans and Jamaica's economic growth and development. I believe in this COVID-19 age and environment, we need all the good news we can get. And it is imperative that we amend the laws of the land and the sea in keeping with the times. Madam Speaker, the clause by clause, clause 1, of course, is the short title on construction. Clause 2 speaks to the amendment of the Principal Act. Clause 3, which is new, speaks to the interpretation. And clause 3, again, also speaks to labor certification and compliance. Clause 4 speaks to the amendments of Section 116 of the Principal Act. And clause 5 provides for the inclusion of the name and address of the owner of the ship and the formula for calculation of wages and the amount of annual paid leave to a seafarer. Clause 6, which is an amendment of Section 120 of the Principal Act, provides for seafarers to sign to their employment agreement after they have reviewed same and sought legal advice. Clause 7 is an amendment to the Principal Act with the inclusion of a requirement for the master to make available for inspection a copy of amend Section 140 of the Principal Act by adding the owner as a person with whom the rate of exchange for payment of wages may be agreed. Clause 12 speaks to leave entitlement. Clause 13 speaks to the provision of water to seafarers free of cost on board a ship. And Clause 14 speaks to medical attention and burial for the seafarer. And Clause 15 establishes a complaints authority where the seafarer can make legitimate complaints about the living and working conditions on board the ship. And Clause 16 provides a provision for inspection of a ship, whether Jamaican registered or not, as long as it's in Jamaican waters, for inspection that it is in compliance with the provisions of the Labour Convention. Clause 17 clearly states in law that there shall be no contribution for repatriation. So if a Jamaican is on board a ship and the ship goes down, or because of the pandemic, they have to be repatriated to Jamaica free of cost to them. Clause 18 speaks to the financial security of abandoned seafarers. Clause 19 establishes the registrar to be in charge if the owners cannot be found to repatriate the seafarer. Clause 20 is an amendment to Section 3(1)15 of the Principal Act. Clause 21 speaks to the inspection or the detention of a ship not registered in Jamaica but in Jamaican waters that is not compliant with the convention. Clause 22 speaks to the inspection of a foreign ship. Clause 23 speaks to the displaying of the compliance certificate. Clause 24 speaks to the exemption of a ship to be examined, and that power is rested in the minister. Madam Speaker, I now ask, with your kind permission, that you could invite other members of the House to contribute to the debate if they so desire. Thank you very much, Madam Speaker.
Thank you. Members of this House are invited to.
Thank you, Madam Speaker. And thank you for Minister. Madam Speaker, we on this side do support this bill, or I should say that any bill that is brought to the House that is in the protection of the Jamaican workers. This bill itself, Madam Speaker, I hear the Minister saying that that government's protection of the workers. But I would hasten to say, Minister, not arguing the point, but the Labour Convention, this convention was signed or brought into effect in 2013. And seeing that we have, as you said, 10,000 workers in the cruise ship industry, and we have other workers working on ships worldwide, when such a far-reaching piece of convention is brought forth, just as a country, as a parliament, we should not take this long to bring it into effect, into our own law in protecting the Jamaican workers worldwide, that work, whichever side that is in power. Yeah? Far-reaching, as you said in your presentation, Minister, speaks about the minimum requirements for sea workers on a ship, the employment conditions on these ships, and so the abandonment of the workers on these ships. The Maritime Authority of Jamaica will be the authority or agency that will be overseeing this piece of legislation. And sometimes we are not effective enough when we pass these laws. And we're hoping that we can use them to the betterment of our workers. I would hope that this piece of legislation will be, some attention will be given to it, and that we have adequate personnel at the authority that will help us to ensure that our Jamaican workers are protected. The convention itself is one that is far-reaching. We have, as of September 2019, some 97 states that have signed on and ratified this convention, which is representing about 91% of the global shipping industry. So this is something that not only us have signed on to, but the rest of the world has. And it is timely, it's better late than never, that we as a country is now amending our legislation to protect the workers of our country in this. So, Minister, we on this side support this legislation, this bill, and we put it for ratification. Thank you.
Madam Speaker, since nobody else is coming forward, I would like to happily conclude the debate on this bill and ask that it be read a second time.
Members, the question before the House is that the bill be read a second time. Those in favour?
Aye.
Those against? The ayes have it.
A bill entitled An Act to Amend the Shipping Act, read a second time.
Members, the House will now resolve itself into a committee of the whole House to consider the bill clause by clause. Members, before we start considering the bill, there is one amendment. I think it is section 11 that the amendment is. A new amendment, that is. 11A. Is it the wish of the House that we put clauses 1 to 10 en bloc, do clauses 1 to 11 en bloc, and then from 12 to the end of the clause? Is that the wish of the House? Those in favour, those against? Very well. So, members, I now put clauses 1 to 11. Those in favour? Those against? I now put clause 11A, which is now a new clause in the bill, as circulated. Those in favour? Those against? I now put clauses 12 to 24. Those in favour? Those against? The ayes have it. I now put the title and the enacting clause. Those in favour? Those against? The ayes have it. Members, the question is that I do report the bill as having passed committee stage with one amendment. Those in favour? Those against? Minister?
Madam Speaker, I beg to give notice that at the next meeting of the House...
A moment. Minister Montague.
I thought you were to report to the House. Madam Speaker.
I just did.
I now ask that the bill be read a third time.
In favour, the bill be read a third time. The ayes have it.
A bill entitled An Act to Amend the Shipping Act, read a third time and passed.
Madam Speaker, I beg to give notice that at the next meeting of the House,
recommit notices. We're recommitting notices of motions given orally.
Madam Speaker, I beg to give
those in favour of the recommittal of notices. Those in favour? The ayes have it.
Madam Speaker, I beg to give notice that at the next meeting of the House, I will move, be it resolved with reference to the resolution approved by this Honorable House on the 29th day of September 2020, appointing a constituency boundaries committee, that the names Honorable Carl Samuda, Honorable Delroy Chuck, and Honorable Eva Grange be deleted, and the names George Anthony Hilton and Julian Robinson be added thereto. Madam Speaker, I further beg to give notice that at a later stage today, I will move for the suspension of the standing orders to enable me to take this motion.
Members?
No, ask Ms. Grange.
Uh,
It's on public business, so she can answer suspension.
House Leader, can we return to
Madam Speaker, have we gone to public business on? We are there, but I think we had to do recommitment. Yes. So, Madam Speaker, the Deputy House Leader, having given notice of the motion orally and accepted, I now move for the suspension of the standing order to enable me to take the motion, notice of which was given earlier.
Those in favor of the aye? Those in favor? Aye. Those against? The ayes have it.
Madam Speaker, I now move that the motion, notice of which I gave earlier, be approved.
Those in favor? Those against? The ayes have it.
Speaker, did we take the three motions for exemptions? Did we? Okay. Madam Speaker, I now move for the suspension of the standing orders to enable me to take the three motions, notice of which I gave earlier.
Those in favor? Those against? Members of... Those in favor? Those against? The ayes have it.
That the motions, the three motions, notices of which I gave earlier, be approved.
Those in favor? Those against? The ayes.
Madam Speaker, the motions relating to the report on the Ethics Committee will now be presented by the member for St. Catherine East Central.
Madam Speaker, I now move for the suspension of the standing orders to enable me to take the motion, notice of which I gave earlier. The question is that the standing orders be suspended to enable the deputies.
No, you have to wait. You have to wait.
Oh.
Sorry.
Members, the question is that the standing orders be suspended to enable the Deputy Speaker to take the motion, notice of which she gave earlier. Those in favor? Aye. Those against? The ayes have it.
You have to get the point. You're not the Deputy Speaker.
Yes.
You're not she, you know.
Yes. Continuing on behalf of the Deputy Speaker who had to leave, Madam Speaker, I now move that the motion, notice of which was given earlier by the Deputy Speaker, be approved.
I know that the question is that the motion, notice of which the Deputy Speaker gave notice earlier, be now approved. Those in favor? Aye. Those against? The ayes have it.
Madam Speaker, I beg to move for a recommittal of the item statements by ministers to enable the Most Honorable Prime Minister to make a statement.
The question before the House is that the standing orders be suspended, that we recommit the item statements to allow the Most Honorable Prime Minister to give a statement to this House. Those in favor? Those against? Prime Minister, the ayes have it.
Thank you, Madam Speaker. Thank you, members. I see the Leader of Opposition Business indicating that he would like copies of my statement. I have them ready for you, member. That should not become a source of contention today. Indeed, as the Leader of Government Business is saying, you will be very happy to receive the statement. Madam Speaker, first of all, I think we should respond to. The nation still has to go about its business. Goods have to be transported. And the taximen and bus operators on whom we rely to carry us around, they also, Madam Speaker, have to use our road network, which is not necessarily presently at the best state. We see their difficulty. And it is for this reason, Madam Speaker, why we have taken the decision to make funds available at both the national level and the constituency level to each member of Parliament to start the process of rehabilitation of some of the worst road conditions across the island. The government, Madam Speaker, has allocated through the National Works Agency $1 billion Jamaican dollars to be spent in very specific ways on improving driving conditions on some of the worst affected roadways. I know, Madam Speaker, that this may not extend to every roadway that is in need of attention. I know, too, that it may not be able to do the extensive rehabilitation works that is required along some corridors. However, it will be able to carry out works that are desperately required. We see the difficulty of road users at this time, and that is why we are now responding. Madam Speaker, of this $1 billion that I mentioned earlier, this will be made available through the NWA to each constituency. Each constituency will be allocated $15 million. And the members of Parliament will be given firm directions on how the resources should be utilized. The program is structured as follows: patching, bushing of verges and overgrown drains, beautification, cleaning and sanitation, and drain and gully cleaning. So those are 4 areas. $7 million of the $15 million, Madam Speaker, must be spent on the patching of roads, and MPs will not have the option of spending less on this activity. Madam Speaker, the government of Jamaica, after these rains, would in any event have to spend these resources on patching our roads. Madam Speaker, the allocations that we have made, the $7 million of the 15 for patching, has to be used very strategically. The government does not have separate resources to allocate to members of Parliament to patch roads of their choice. And then, Madam Speaker, make a whole separate allocation for the NWA or the parish councils for that matter. So it is one pie, it is one set of roads, and we all have to collaborate. So the members of parliament have to work closely with the NWA to look at the list of affected roads and together make the allocation and selection of roads. Madam Speaker, when we designed the program, we realized that if we had placed all the resources at the disposal of the NWA is not a political organization, and therefore the basis on which it would select roads would have to be on some objective that is focused on, for example, the growth of the economy. So then you would be looking at the carrying capacity of the roads, which roads carry the most traffic, and therefore it would be those roads that you would want to focus most of your resources. But Madam Speaker, what are of the roads in West Central St. Catherine, which have been badly damaged, or in Southwest St. Elizabeth? They may not carry the volume of traffic, but citizens live there, and people are affected. So the government has taken a balanced approach. So the resident in Mile Gully in northwestern Manchester will also, and we're not guaranteeing that all residents in that community will have, but at least the member of parliament who is feeling the pressure, because to be fair, the residents don't bring the pressure on the NWA. They bring the pressure on the MP. And it is the MP that has to at least have some capacity to respond. So the idea is not for us to be wasting resources, to give it to the MPs for them to do as they wish. But through a process of collaboration, let's look at the roads that are needed to support our economic development and support the movement of traffic, but also let's look at those roads that cause severe inconvenience to local communities. And the MPs and the councillors are in the best position because they see directly, firsthand, the issues. And they would be able now, with their constituents, to determine, all right, we can't do all the roads, but for this community, here is the difficult situation, and this is the one that we are going to pay some attention. It's not a lot of money. Not a lot of money, and I have to say this very clearly, because there are those who would feel that the MP has been allocated the national budget. That is not the case. This is a very small amount of funds, and this is to be used for road patching. Patching is not the same as rehabilitation, which would mean the resurfacing of several miles of roads. This is not what the allocation is for. But, you know, there is this one bad pothole on a road. That has destroyed 30 or 40 front ends so far, that you need to just address. That the parish council hasn't addressed it. NWA is not going to come around to that because that's not part of their schedule of roads. That is something that the MP can seek to have addressed. But of course, as I've said, in collaboration with the NWA to ensure that the standards are met and the proper procedures are followed. We see the difficulties that are being faced, and we have decided, Madam Speaker, as I've said, to respond in this way. Now, the cleaning of critical drains and gullies in constituencies is also an imperative. That activity has to be carried out under the program I have mentioned, which I have given instruction that this be done immediately, and they should start mobilizing, the NAA should start mobilizing for this right away. Madam Speaker, we are seized of the importance of proper functional drainage systems and how they contribute to preserving our roads and extending their usage and preventing flooding of homes and other properties that is in proximity to the roads. So outside of the 7 million for patching, we are allocating 4 million for debushing, 2 million for beautification, which is really sanitation and the removal of garbage, and 2 million for drain cleaning or gully cleaning. Let me just run through this, Madam Speaker. This year, we have focused the Christmas program, as we traditionally call it, but this is the routine maintenance program, which coincides with the Christmas period. We're focusing it on our roads. Now, the road, Madam Speaker, includes the drains that run off it. It includes the sidewalk and the verges. And as I go around, Madam Speaker, and I talk to my MPs as well, they complain that several of their roadways are overgrown. And it is very difficult to maneuver, negotiate some of the areas. And we haven't done any cleaning and bushing for a little while. So everything, and plus the weather, the overgrowth is extreme. So, Madam Speaker, the focus on the road will be on the surface for the patching of potholes. It will be for the verges, for the clearing of the overgrowth as much as possible. And then it is the clearing of the drains that are running directly off the roads to make sure that those outlets are clear. Yes. And then, Madam Speaker, oftentimes when we do these kinds of work, the debris is piled up and left. So we have put aside 2 million as well for the clearing of the drain and 2 million for the removal and cleaning of areas. So all of that together comes up to $15 million. Yes, so it's 7 million. Oh, you thought it was 70? No, it's 15. It's 7 for patching, 4 for bushing, 2 for beautification, which is really the cleaning and removal of debris and rubbish, and 2 for drain cleaning. So that's 15 million. Yes, and this strategy, you will recall that last year, Madam Speaker, we had included in our routine maintenance program, which coincides with Christmas, we had included $3 million to deal with the dengue threat. This year, we were not able to do that, given the threat. However, it doesn't mean that we still would not be able to tackle breeding sites. In fact, I would hope that our MPs would use these resources to tackle areas that are breeding sites, because whilst we are all focused on the COVID pandemic, we have also been effectively focusing on managing the dengue situation, and we have been doing fairly well, and I would encourage MPs to use these resources to continue the fight against dengue. Just to be clear on whether or not funds can be moved, so as usual, Madam Speaker, MPs are not allowed to reallocate funds from road patching. So the $7 million is set. That's the minimum. MPs are allowed, MPs may reallocate a maximum of $1 million from drain cleaning to any other heading. MPs may reallocate a maximum of $1 million from cleaning and sanitation to any other heading. And MPs may reallocate a maximum of $2 million from debushing to any other heading. MPs may choose to reallocate a maximum of $4 million to the patching program from all allowable headings. So if you decided that you wanted to take $2 million from bushing, $1 million from drain cleaning, and $1 million from debris removal and beautification, and put that on patching, then you could spend $11 million on patching, if that is your desire. So for MPs who don't have, for example, so MPs that don't have urban MPs who don't have to worry about debushing and drain cleaning, they can spend, which is the case, because they would have more road density, more roads per square mile to treat with. So that is how the program is designed, Madam Speaker, to ensure that we get the maximum benefit towards roads and all the other civil infrastructure along the roads, and to ensure the maintenance of the verges of the roads. So it's a program that will generate some much needed work for Christmas, though very short term, so persons can have at least, a small income over the Christmas period. But at the same time, it is about improving the infrastructure so that our economy can quickly return to normalcy. Madam Speaker, the NWA has now managed to put together a comprehensive list. Well, before I continue, Madam Speaker, just to be clear, so by tomorrow, MPs will get their program letters about how they should go about putting the program together. But I must stress that this has to be in collaboration with the NWA. Minister Warmington is there to assist MPs who may have difficulties, questions, or concerns as to how the program. Council or assist, whichever one. Huge. I haven't yet told the Minister of Finance what it is. He's going to be hearing the bill for the first time. Extensive damage to our road infrastructure has occurred. It is estimated that some $5.4 billion will be required to undertake various stages of the recovery and reinstatement of our roads to reconstruct and bring them to the desired standards. Of course, as I said in my presentation last week or the week before, that when these events happen, we will give you the compilation and the associated cost of what would be required to bring the road to what we could consider to be the desired standard. Now, the desired standard may be above what the road was before the weather event happened. To bring the road back to usable standard, which might not be the most comfortable ride, it might not be the most enduring and durable repair, but just so that you can use the road, we would require somewhere in the region of about $2.3 billion. What has always happened to us, Madam Speaker, is that after every weather event, our road network and infrastructure is degraded and never brought back to what it was before or above standard. And as we are now going to have more frequent weather events that are degrading our road capabilities, we are going to have to think very strategically now as to the new roads that we are building to make sure that they have carrying capacity, which roads we are going to improve, turn them into main roads so that they are at the highest standards, because it is not possible for the government with our existing resources to rehabilitate every single road. It also drives, Madam Speaker, decisions about where we choose to live, because it can't be that we live everywhere in Jamaica. We have to build a road to everywhere in Jamaica, but we can't maintain the roads. So the weather events, the climate change, and all the other factors, including our fiscal ability to respond, is also driving our decisions as to how we, as a responsible nation, responsible government, how we decide to settle Jamaica. In other words, our habitat policy, where we decide to live. It can't continue as is, where everybody chooses to go and live where they want to live. Our settlement policy has to be far more aligned to our budget, to our ability to maintain our infrastructure, because the long term is, as it is, we are seeing with weather events, that these weather events are going to be more frequent and more intense. So, Madam Speaker, some $2.3 billion would be needed, and we have already started to spend some of that, to reopen and to bring back roads to drivable conditions. Of that $2.3 billion is the $1 billion that we are spending now, of which the MPs, will be directing, and I'm expecting that they would be directing it to satisfy the needs of local citizens, of the local residents in communities that may not get the direct attention of the national agency. Because the national agency would be focusing on the main thoroughfares, the ones leading into the town, carrying the heavy traffic. But what about those leading off? So that is the thinking. We are trying to ensure that all of Jamaica gets some form of the response. And I'm saying to MPs, you have to use these resources to ensure that the people of Jamaica feel that their government is responding to their needs. So in effect, you have a part to play in the national response by ensuring that there is a local presence and response. So, Madam Speaker, I just thought I'd make that. So, Madam Speaker, very quickly, I want to just bring the Parliament up to date and the country up to date. The NAA has reopened all except about 4 corridors. When I mentioned last week of the corridors that were closed, they have now restored them. Recall that I had said Thompson Town, that has to be totally reconstructed. And it is still on our budget. I see the Member of Parliament for Northwest Clarendon pointing out that that is still outstanding. And that would be, you know, that requires far more than just rehabilitation. In the Gordon Town breakaway, the NAA is working feverishly to make the Savage Pen Parish Council Road a lot much easier to use. They are estimating that it will take about 2 to 3 weeks to get that done, but I know that they are trying their best to get it done before 3 weeks. We are encouraging the residents in that area to use the road carefully and to be patient, and to encourage residents to just be careful around that breakaway. You know, you can never tell what other event could happen. So persons should avoid that area. The engineers are looking at the possibility of rerouting, and they will come to me shortly with the options as to how that can be corrected. We're also looking at the Duhaney River in western St. Andrew and the Monticot Rivers in St. Thomas, because we will have to find some engineering solutions about how we control those rivers. So, Madam Speaker, I trust that all members of Parliament now have a clear understanding as to the government's response and their role, and I am hopeful as well that the people of Jamaica will also understand the fiscal constraints of the government, but nevertheless understand that the government does care and the government is trying to be as responsive and as quick in that response as possible. Thank you, Madam Speaker.
Leader.
Michael just said thanks.
Madam Speaker, I wish it was as easy to just say thanks and sit down. But I am not sure if the members on that side is getting more funds than what we are getting, why the reaction that there. But any which way, I am sure that the member from Western St. Mary, who generally refers to himself not as a rural MP but a country MP, will understand where I'm coming from. Yeah? Madam Speaker, through you to the Prime Minister, and all of us as members of Parliament are truly grateful that something is coming to us to respond. That is a fact. What is important is for us to at least let our constituents know that this is not an additional program. Right? This is the usual program that will come at the end of the year. Right? This is the usual program that would come at the end of the year. And as the
Madam Speaker,
will you just be quiet and allow me
may I
to
clarify something here? No. The member
Madam
is saying
Speaker, Madam Speaker,
that this is.
Madam Speaker,
I asked
Madam
the Speaker's
Speaker,
attention.
will you let the member allow me to just make my point?
Will you
allow me? You're misleading the nation.
But member,
both members allow me.
Yes. You're misleading the House.
Just yield for a moment. Is it a point of order, member?
No. A clarification, because it's misleading the House. It says a normal stuff. Under his government, we got 3 million per year for Christmas. Now we're getting 50 million. So don't say the normal thing better Christmas. It's not the normal stuff. Cut it up.
Madam Speaker, if the member had waited, and the member seems to be quick to jump on his feet, to yap his mouth all the time, I was going to further say that we, over the last few years, we have been getting $12 million. With this program, we are getting an additional $3 million. Now, will you shut up and allow me to finish speaking? Right? Now,
members, please, both members, I ask that we use parliamentary language and remember where we are. Members? Member, please.
And
please, shut up.
Madam Speaker, I'm just saying that as much as we are getting this amount, and the Prime Minister speaks of the fiscal responsibility and the tightness in the budget, and I speak as a rural member of Parliament. Now, in this instance, Madam Speaker, Prime Minister, we're appreciative the breakdown is $7 million for patching, $4 million for bushing, $2 million for drain cleaner, and $2 million for beautification. I would have hoped at some point, Prime Minister, just like the Minister of Agriculture did last week in speaking about a tier system, because the amount of bushing that needs to be done in rural constituencies, and I am one member of Parliament who do not believe that I should use my CDF for bushing, but for different other projects within my constituency, is left at a disadvantage of the size and width of my constituency to do $4 million of bushing. That is first and foremost. Right? So, Prime Minister, I'm hoping that in the future, especially when we have periods like this, where we have a lot of rain, and the bushes that we are experiencing, as all the mongoose left to take away the people about the road. Right now, this in itself is not adequate enough to help some of the rural constituencies to do any meaningful bushing at this time of the year after the rains that we have seen. This is the first case. So, Prime Minister, you speak of the what is needed right now, or the estimate of $5 billion, which is basically to clear the blockage that is. It is not really, which what we have been told at the Infrastructure Committee this morning, that $5 billion is not inclusive of bringing the roads, rehabilitation of the roadways. And I come back to the point that I often make in this House, Prime Minister, is that our reality is that the budget usually prioritizes towards damage repair and not mitigation. And again, I urge you, Prime Minister, is that going forward, we have no control over our weather system, but we spend much more on an annual basis responding after the fact than if we had spent before in the mitigation proportion of our budget. And I use as an example, we keep putting $300 million in our budget year after year towards mitigation. This year, in the second supplementary, added an additional $500 million, but which was to take care of expenses that was monies that was spent before in clearing some roads, previous rainfall. And we have spent between 2015 to currently 2021 in what we have we have contributed to the National Works Agency towards mitigation and road works. We have spent some $9 billion more, $10 billion after the fact in what is generally tabled in the budget compared to what it is that we have to spend additionally in responding after damages that have been caused by rainfall and other activities. So again, Madam Speaker, to you, Prime Minister, let us think about the mitigation and not mitigation after. It can't be mitigating after the fact, but mitigating before, and we will end up spending less in the damages that may be caused in some areas. I said to you the last time that let us, knowing that there was going to be more rainfall, let us try and see if we could do some emergency drain cleaning in some areas. Mr. Prime Minister, we have seen some, right? And we are happy for this amount that us as members of Parliament can assist in that mitigation and some drain cleaning. So, Madam Speaker, we are happy on this side. I was hoping to hear of what we are seeing. Thank you, Madam Speaker.
Thank you, Madam Speaker. Prime Minister, a question. Last year, when you made the allocation and you had a similar environment of the amounts, you indicated that in terms of the road patching, there was a period of time that you could extend it to. Mindful now of the weather patterns that we're having, and it might not be prudent to patch some of the roads now, is there a period within which, after which it will not be available anymore?
Good question. For the road patching, you could have the funds until the expiration of the fiscal year. So it behooves you to use it as quickly as possible. Fiscal year ends on March next year, so you have enough time. But I would encourage you to, get the roads repaired certainly in time for January, as that would be a good target time. There are other weather systems that are forming and coming into the region, so we have to be very careful about what it is we're doing. We have decided to proceed on the good faith that we will continue to be protected by our Father, who has guarded us with his mighty hand and kept us safe, and we are hopeful that that will continue. But I would encourage members of Parliament to start putting your programs together, start getting out there now to get the work to begin.
Prime Minister, thank you, First Prime Minister, for referencing in a presentation the Duene River. And I take note that the assessment is still being done. And so I await that assessment, and hopefully that responds quickly enough to the situation so that we don't have an accumulation of the situation. But in the same way that the rural member speaks to the need for a greater emphasis on bushing for the rural areas, in my instance, the situation is a drain and the drain network that proliferates throughout, certainly the lower parts of Western St. Andrew. $2 million, Prime Minister, from time to time, I really don't even know where to begin with that $2 million on the drain. And we will, it is wholly inadequate, and the strictures that you've put in place does not allow us to vie, as you said, rather other than in limited circumstance. We'll work with it. We'll work with it because we have to. We know the situation, but it is by no means an adequate situation. Right? And I just want to make clear, and maybe you can clarify in your response, Prime Minister, that although we're working with NAA on the patching, that an amount for contractors would be coming from that $7 million, because how would NAA itself be doing the patching? How would that be done? Is it from the $7 million the contractors to be paid, or NAA will carry out the contracting on some sort of force account itself?
Madam Speaker, last year there was some issues related to the fees charged by the NAA. You know that the NAA has to earn resources from the projects it supervised. Last year, we got them to reduce the supervision fee. Minister, I don't see, where's Minister? Minister Warmington. The supervision fees, we managed to get them down. This year, we will have to pay them some supervision fees. And I think, Madam Speaker, I see there's a permanent secretary was here with me. We will do 2.5% as the supervision fees for the NWA. It is my inclination, I agree with you, and I've had a debate. But the reality is that they have to supervise. They are sending out their staff members to supervise the work. So there has to be even a token fee for them to collect. So 2.5% would be the fees.
Prime Minister, if you allow me, please. Sir, but in the past, the amount that we would have gotten to each constituency would have been the net amount. And, last year it was, and the year before, not the year before. So now that we are seeing that we have this emergency, will the Prime Minister consider, as you did last year, this year? Because, Prime Minister, believe me, what the damage is out there, and I know you know, is one that this amount is not going to even scratch the surface, but it is something, it is a start. So I'm just asking you to consider if the agency fee can be dealt with by your ministry and the Ministry of Finance.
Prime Minister, I have long held this objection to this agency fee. When allocations are made to members of parliament, quite frankly, it is to do things that the central government or the local government entity should be doing. Whether it is drain cleaning, whether it is bushing, whether it is patching, or whether it's helping with a health center, it is a function of a government entity. When we make the allocations across the administration to members of parliament, is to give the opportunity to members of parliament to target needs that may be overlooked by those agencies for which representations are made to us as the members of parliament by the citizens. If those work were to be done by the agencies, it would be from their emoluments. When you have cases where they engage extra personnel to supervise the work, so it's extra cost over and above the recurrent provisions in their budgets, I could see that. But they're spending the same government money. The only difference is that the MP specify where the work is done. So I'm strongly not in support of this agency fee. They have come to committees many times and tried to make cases for it, but it don't stand up, and we are perpetuating it. The monies spent for these agency fees can be used to expand the scope of work which is completed that the citizens can benefit from. And particularly in this circumstance, where we have significant damages, you have spoken about them, and it is true. We need to be more responsive to those situations. In my constituency, for example, many of the roads, I've never seen them damaged like this for decades. Take, for example, the Naggohead to Brayton Main Road in my constituency. You can't drive 10 feet without dropping into a crater. I've never seen it before. I'm just waiting until the rain subsides for the NWA to tell me what they are going to do. In Greater Portmore, we have a number of roads. We have never seen them like that before. And when you can do so many more yards of road, you're not going to be able to do it because the agency fee is going to absorb that much more. 15 million, yes, we need a lot more. In fact, quite frankly, I wouldn't mind getting none if all the roads were fixed by the agencies. If they are going to fix them, all of them. So, Prime Minister, let us just say cut out this crap. And with the agency fee thing, it has been in place when our side was in government, and I fought it then, and I'm continuing to fight it. So we can get more value for each dollar that we spend. Thank you, Madam Speaker.
Madam Speaker, the member's impassioned plea has not fallen on deaf ears. And it does make a rational argument. The challenge is, of course, that the agencies, take for example, the NSWMA, which would be the agency tasked to execute the beautification, that is the sanitation and debris removal aspect of the project. Yes, the funds would be channeled through them, but now remember, they would have to pay additional supervision and accounting, which does impact on their budget. They then can't turn around and come to the Minister of Local Government and say, I need more money. It is, you know, I see the logic in what you're saying, and I too share the view. But I also see the situation from the other perspective, which is when the agency head says, the budget that the government has allocated for me is almost finished, and now you are giving me funds to expend, and you want me to assure you that the work is done according to standards, so that means inspection, and you want the checks to be available to be paid to the contractors, so that means a certain level of accounting. And then we have to prepare reports to come to the very committees of Parliament. That's a cost. So it is, you know, I wouldn't dismiss it to say the agencies are unreasonable. My position, which is what I've taken now, is that the agency fees are usually about 5%, some as high as 7.5%, and we have reduced it to 2.5%. So I think that is a position that we should accept until we are able, by virtue of having a larger budget, to treat with this. Well, we'll see how it can be done, Madam Speaker, but I think we have come to a reasonable position.
Well done, Prime Minister. Madam Speaker, I now move that we have a recommittal of public business, so as to allow me to take the motion moved by the Deputy Speaker with regards to the amendment to Section 73D of the Standing Orders, which relates to the Integrity Oversight Committee. So, Madam Speaker.
Members, may we have the approval of the House in relation to the amendment relating to Section 73D. We're at public business. We are in public business, so we don't have to recommit. The amendment, the suspension of standing orders to allow us to approve the amendment as it relates to 73D of the standing orders in relation to the Oversight Committee. Those in favor? Those against? The ayes have it. House Leader.
Madam Speaker, it isn't intended to do any further business today, but I might just...
Report.
Oh. Yeah, Madam Speaker, I now move for the suspension of the standing order to enable me to take the motion of which notice was given by the Deputy Speaker of the House.
The question is that the standing orders be suspended to enable the House Leader, on behalf of the Deputy Speaker, to take the motion, notice of which she gave earlier. Those in favor? Those against? The ayes have it.
Madam Speaker, I now give notice that the motion I gave earlier be approved.
Members, those in favor? Those against? The ayes have it. House Leader.
Madam Speaker, it's not intended to do any further business for the day, but I wish to indicate, Madam Speaker, that this honorable House has been meeting here at the Kenneth Rattray Conference Room. And we have been working assiduously to reconfigure the Gordon House so that it would be ready for the usual activities that we know have been accustomed to doing there. Madam Speaker, we were hoping that we would have been there this week. The work is going on, and we expect that it will be finished completely, hopefully for next week. However, Madam Speaker, in the interest of caution and to be sure that all the work is done and ready, we will come back to this this chamber, this conference room next week. So I ask next Tuesday. So I ask, Madam Speaker, that we adjourn the House until Tuesday the 25th at 2 p.m. here at the Kenneth Rattray room.
Madam Speaker, I just need for the House Leader to clarify, because last week we were told that we were going back and that the premises were ready for us. What has caused us this 2-week delay? Because I thought everything was in place for us to return. Up to this morning. Up to this morning, yes.
Madam Speaker, you and I inspected, along with the Deputy Leader of Government Business this morning, the activities. And we see that the work is going in earnest. But there are some further adjustments that have to be made, and some adjustments in terms of the in terms of the furnishings and so on, and indeed the way in which the room has to be further reconfigured to ensure that we meet the social distance protocols of the Ministry of Health, and also that we have the appropriate sneeze screens that ought to be there in the same way that everybody who deals with public activities, whether at the banks or at the airports or wherever, is had. And so the Parliament cannot, in all fairness, be the ones who uphold the protocols in terms of its breach. We have to be there along with all the protocols that are established for the good management of the pandemic. Thank you,
Member, just a moment. Members, before you speak, I want to commend Standing Order 71 to the House, where it speaks that the House Committee shall have the duty of considering and advising on all matters connected with the comfort and convenience of all members of the House, and from time to time reporting to the House on its minutes of proceedings. Member, I am comfortable, and I think we all should be comfortable that the House Leader is doing all that is possible to make sure that the House is comfortable for us all to operate. He, like the rest of us, is anxious to leave this. Well, we are thankful for the use of the building, but would like to return to our usual home.
I share your expressions, Madam Speaker. However, the inquiry being made by my colleague, Leader of Opposition Business, is that he apprised the members of the opposition side earlier today upon making the visit with the House Leader and the Deputy House Leader. And my information is that the work was proceeding satisfactorily and in such a way as to realize the objectives that he spoke of. And I'm happy for that. However, I gather, and I would like the Leader of Opposition of Government Business to indicate, if it is so, that the construction that was done in keeping with social distancing, etc., was fulfilled. However, the building is going to be further delayed because the side where the opposition is seems higher than the other side, and now there's going to be a further delay. I want the House Leader to tell us if that is so or not.
Madam Speaker, I think, first of all, there is an issue of accuracy. The opposition leader of government, of business, House business, was not part of any team with us that inspected this morning. No, but so please, in the interest of accuracy. And secondly, the suggestion that a decision is taken because of how the elevations might be in the House is inaccurate in its entirety. What needs to be done, however, is a balancing in terms of the seating arrangement within the House so that both sides, in the same way that when we had our discussion, opposition House leader, we looked at the whole matter of where the opposition should be in relation to the Speaker so that she could catch their eye as the case might be. Is in a similar way we have to look at how the balancing in the House has to be to enable all of us to essentially operate at the levels where we should. And we are going to insist on that, and in keeping with standing orders and the requirement of the leader of the House and the team to ensure the commodious arrangements of the House. I so move, Madam Speaker, that that reality be understood, and secondly, that you do adjourn the House until Tuesday, the 25th of November, here at the Kenneth Ratchey Room.
Yes, just before we adjourn, though, Member Jackson, there's only one person that the standing orders allows you to get a report from, and that is from the leader of government business. So I don't know where your report came from, but the only report ought to come from the leader, and that is 71-2. And we have had a report from the leader of government business, and I can assure you that we are going to be in comfortable circumstances when we return. I thank you very much. The question before the House is that we do adjourn until next Tuesday, the 24th of November, 2020. Those in favor? The ayes have it.